remind you that you can connect online after the forum and review the videos, publish posts at the social media. So our social media, GMKA, LinkedIn, Instagram, and so on. If you want to share your feedback, we'll be happy to receive it. And we'll be happy if you become our followers because evidence-based medicine um, should be used. I think we can already start. So I'm giving floor to our founder. So good morning. I am Nela Melnichuk. I am the co-founder of GMKA. I am also a surgeon at Harvard Medical School, and this is our second forum. We did a similar one last year. We are happy to welcome you today. We thank you, our partners and co-organizers, and the Ministry of Health that is supporting us. We are happy to welcome from the University of Toronto, King's College London, and the rest of the participants that want to support women's leadership in medicine. Um, we were yesterday at Clinton Global Initiative, and we also heard a lot about the women's leadership. We met Oleksandra Matviichuk, who recorded an inspiring video um, because the women's leadership changes the country. And Alexandra Matviichuk asked us to come together and create a community that we started last year. We could also see the Kosovo president who mentioned when she was a young girl during the Kosovo war, she was queuing for food herself. And now she is the president, and this is quite an inspiring story of young ladies and women. You can see on the stage a lot of current leaders, future surgeons, and we are happy to support medicine development in the future. Dear colleagues, good morning. I'm happy to see you today and yesterday, and some new of you who have joined us today. Without further ado, we have a very intense agenda. I'm a bit worried about our timing. I would like to mention that we have a member of young Ukrainian community that has gathered us. So I would like you to understand that the efforts that we are investing, it's for the future. And just to summarize, I thought that we need to mention something smart. I would like to cite Olha Kobylanska, one of the first feminists in Ukraine, used to mention that it's time for smart women. So it's our time. Thank you to Inesa Huivaniuk and those who have joined us today. So Inesa is the executive director of GMKA in Ukraine, and she heads the women's leadership. From my side, I would like to highlight that women who have leadership positions 2.5 times had other more women mentors, and she as well had better results and higher financial compensation. That's why women create communities that reinforce each other, and it's nice when a woman helps another woman to network, and it's important to develop key competency. So I give the floor to the participants of the Ministry of Health. Let's start from the deputy, Yevhen Honchar. Men are also the part of supporting women's leadership. Thank you. 8 out of 10 staff are women. More than 60% of doctors are women. In the primary care, there are more than 80% of women. This is more than on average in the world. where the medical staff is about 60% women, not like 80% like in Ukraine. When it comes to women's leadership, even the managers in Ukraine, 54% of managers are women. So even we can see that the women take up more percentage on the managerial positions in the European countries. For example, this is just one fourth. So it means that in Ukraine, medicine is contributed with women, and they contribute their energy. At the same time, Uh, when it comes to specialties, there is no so equal distribution. Only 5% of traumatologists are women. And when it comes to surgery specialists, only 15% are women. We can see that the more interventional specialty is, the more technological specialty it is, the less women are working in that sphere. So women are well represented in medicine, but they are not symmetrical when it comes to specialties and other domains. So we can see this injustice because in the primary care, 80% of doctors are women, and they are the first contact of the patients. So, but when it comes to management, it is proportionately less, approximately 50%. That's why we have these elements of vertical injustice, but kind of lack of symmetricity. And we still have a lot of to work at and improve. And I'm happy that the medical sphere is so well represented by women. And thank you for your work. And I hope that GMKA initiatives will reinforce the role of women both in healthcare system and economics of Ukraine. Thank you. Thank you. A round of applause to Yevhen. So, Vasil Slivka, do you agree with Yevhen? I fully agree with Yevhen. I would like to add something that we can see in the Ministry of Health. We have great examples of women's leadership. I would like to mention women, for example, Maria Karpevich, that is responsible for digitalization, and we are really impressed with her. She is very hard working, and sometimes she is also does some different. She's working in various domains, and she managed to do the reform. Another example, this is Miss Iryna Simonenko, which is also working in the Ministry of Health, and she did it in such a way that we have targeted MediaVac when the heavily injured soldiers who can be immediately transported to certain institutions of the city of Kyiv at the beginning of 2022, where there was Matviichuk Hospital in Dnipro for a few days, and then in Vinnytsia for 2 weeks, and then there was another a series of hospitals. They waited for complications, and only then they already had to deal with complications that had been done at the previous stages. And we, the men, together with my colleague, were trying to change something here. We tried once or twice. We talked, and we didn't know what to do because it was difficult. But our colleague did the resolution, and she said she would work in the Ministry of Health until it is adopted. And I witnessed when the military personnel didn't agree, when there were 6 colonels sitting around and Iryna facing them and using argumentation why they hadn't dealt with the issue. And in an hour, everyone agreed to that. So now we have the opportunity in Ukraine, this mechanism of targeted medical evacuation. So this is an example when that we all have equal rights we are not discriminating by age and by gender, and we have great opportunities for countries' development. Thank you, Vasil. A round of applause. As far as I understand, some participants haven't woken up. So we would like to give the floor Michelle Hladunewich, University of Toronto, who is the co-organizer of this conference.
Добрий ранок. Я розумію, але добре не говорю. So I will speak in English. I'm from the faculty, I'm from the Temerity Faculty of Medicine at the University of Toronto, and this has been a wonderful collaboration for us. We have quite a number of our staff who've come here to participate in this conference. I've also spent the last week in Unbroken on a medical mission, working on the floors, working with the young doctors, and the future is female, as put on the T-shirt in the front row, and I'm really excited to be here with you all today. Дякую дуже.
Thank you for kind words. And Gemma Bowsher from United Kingdom.
Thank you so much, friends and colleagues. And on behalf of Professor Richard Sullivan and myself from King's College London, I want to say thank you so much for the invitation to join you today. It's been an amazing day of conference already. The discussions yesterday were engaging, ambitious, and very lively. And I have no doubt that the incredibly important subject of women in medicine will also provide the same level of liveliness and ambition. So it's a pleasure to continue to work with our friends and colleagues in Ukraine, who we've been working together with for obviously 3 years now, and may today also signal more fruitful collaborations and to continue to build the incredibly strong networks of women in medicine in Ukraine. Thank you, everyone.
Thank you so much, Gemma. І також співорганізаторами даної конференції і вчорашнього дня є організація «Разом», про яку багато хто знає. Її представницею є Лілея Джалюк.
The representative is Lileya Jaluk, so the floor is yours. So greetings to participants, colleagues, experts, partners. I am Lileya Jaluk. I am the director Razom Health in Ukraine. And thank you for this opportunity to talk. I would like to highlight that today we've gathered under very complicated conditions, but in very important time, and we can have an opportunity to hear your voice, which is within the health system of Ukraine. We, as the organization, an American organization, and represent the international domain, which helps to coordinate our development and share the knowledge that we can bring from abroad to Ukraine. That's why joining such initiative takes a lot of our time and effort. And I would like to say that today's day is not just an event. I am dreaming of you leaving this hall being inspired to introduce changes. You have already started this path, and hopefully together, step by step, we'll be able to reinforce the healthcare system and create this environment to make it safer for our patients and go together to victory. Thank you, Lileya, and we cannot but develop our healthcare system without education. So, Inna Kocherenko, the floor is yours. She's from the Medical University of Ivan Bohomolets. Thank you for such initiatives. University, these are people, students that we are teaching, and you will have them tomorrow as your colleagues. And we hope that the educational environment is not only gender balanced, but also equal from the gender perspective. When it comes to statistics, 3-1, these are students, but today's nurses, this is 4-1. So 4 men, 1 woman. That's why there are a lot of things to consider. We thank you for this initiative. And last year we did some changes at the university to create the best conditions that both men and women feel comfortable. Thank you. The round of applause to Miss Inna, and the final words to our team, Anastasiia Prostai, which heads the PR domain, and she is a representative of the bloggers community. Thank you, Katya. 15 years ago, I graduated from the medical university with a clear aim to become a surgeon. I have been dreaming about it since childhood, but at that time, I was listening to rector, and he mentioned something like, if you are a woman, you have to be a therapist, you have to be at home at night, your husband has to know where you are. So surgery is like a man related domain, and your husband will be jealous. I was listening to this speech. It was really painful to hear that. But now, 15 years later, I'm here at the stage of women in medicine. So there is clear progress. You can all see we started our speeches with the fact that that my daughter was here, and she was here with us last year. She was 6 weeks old and she was present already. I was given this chance to take my daughter along. Today she's 1 year old and she's with us again. I hope she will remember, she will have this tradition adopted, being at the forum every year, and regardless what she wants to become, surgeon, the nuclear specialist, it's most important that her world that we will build in the future, there shouldn't be any space for gender inequality.
So let's build our future starting today. Thank you. I'm inviting to take seats, dear guests, dear representatives. I'm inviting to the acting director of GMKA. Last year, we initiated such an award in honor of Melina, and it was initiated by Heal Ukraine Group. It's a unit of doctors from Harvard, from our organization GMK, and Harvard organization Trust. We initiated it to honor Viktoriia Melina, who used to be a writer, but she died, and she supported female leadership and gender equality. It was a first award. And the first winner, I'm still learning some Ukrainian words, how to say female in Ukrainian. So the first winner was Lesya Strelka, who is a surgeon in Kyiv. Yesterday she was present here today. Today I can't see. And the second winner was Inesa. And the third winner we are going to present, she's going to be presented by Natalia Kovalchuk, who is a physician in Stanford. And we open this award ceremony for all observers and doctors who came to our states, who were in different institutions and hospitals. We are going to invite Natalia Kovalchuk. Dear colleagues, please help us with the online connection. We need to have like 2 visitors. Okay, Natalia, welcome. Welcome. A little louder, please. Can today it's an honor for me to present to this award by Viktoriia Melina, an honorable doctor and the doctor of radiology, Dr. Zoya Shefin. After her training in Stanford SLA, she showed herself as a real ambassador of Ukrainian radiology. She presented Ukraine on like a famous international conference, Astro, ABS, ABG. She had the presentations about the conditions of radiology and the therapy in Ukraine. Also, she participated as a participant of MAHATE, as a representative of Ukraine, and she is the author of many Ukrainian publications on the topic of Ukrainian war and oncological healing, and she does a lot of researches in Help Ukraine is an example of deep dedication to this area. And when she came back to Ukraine, she became like a very high inspiration. She had done 3 days training for radiation oncologist, therapist, and she organized and he gave lecture to OncoHub Gastro as a main researcher and coordinator. She shared research methodology, and she has she runs a few research projects which research the effects of radiation and oncology. Also, she provided this influence of that on patients, and she has like a very high, big influence on new students. And she's a co-founder of Association of Radiation therapists, and her contribution is like foundation for the future development of this area, and her big significant in of her medical input in the one of the toughest moments of this war. This doctor, she had her own losses. In 2014, she had to move from Luhansk, but despite more than 10 years of challenges, she keeps working with a very high courage, dignity, and dedication to patients and to Ukraine. For this, her research talent, professional dedication, human resilience, today we are awarding Dr. Zoya Shepel with the award named by Viktoriia Amelina. Thank you, Natalia. Is Zoya with you? This is Zoya. We have an award for you. Congratulations. Thank you for your huge work for Ukraine. Thank you. Can you hear me? For me, it's an honor for me to receive such kind of award, but I think that it's like common achievement of my team of Help Ukraine group, which during the full invasion was for concentrated on work for the development of this oncology development in Ukraine. Did a lot of research in Ukraine through the trainings in Ukraine and outside Ukraine. I'm very proud to receive such kind of award as a representative of Help Ukraine Group, and I really hope that we will continue our work, which is, to my opinion, has a significant contribution to the development of radio oncology in Ukraine. We have a very good feedback from colleagues who visit our courses and trainings. As it was mentioned that more than 80% of colleagues who we met in radio oncology and there are women, and their role is the key, and we hope that this role will keep growing, developing, and Ukraine will be introduced as a significant contributor to this area in the world. Thank you, Zoya. Thank you, Natalia. Thank you, Zoya. So congratulations for you, and I hope next year in peaceful Ukraine in Kyiv we would give this award to the next doctor, medic in Ukraine. We are inviting you. Looking forward to seeing you in Ukraine, and very big gratitude on behalf of female community of doctors in Ukraine. Now we will not keep to our program a little because we have a great possibility to give the microphone to Nelia, and she will comment on this. Also, it's difficult to talk about this minute of silence and to continue this work. By the way, we've been thinking along a way to start this initiative after war, or there are other more urgent needs, and we had to channel our efforts to this and start female leadership in medicine and our program after the war. But we've decided the war is a time for changes. Yes, it's very costly. Yes, I feel very sensitive. We need to respect those people who died and rebuild Ukraine in this way, how they would like to see it, why they died. I will switch to a different topic. I want to call Dr. Davis, who is a co-founder of Consortium. It's not an NGO. It's a consortium which is called UAMed, and we are a global medical global alliance, and with all organizations which you can see here. A part of this consortium, UAMed, is a consortium which joins organizations in the USA, Europe, who help Ukraine in medical area for better coordination, observation, in order we could do our work together, not like parallelly. And Dr. Doug Davis, he's the founder, and we will call him for a few words.
So I like to. So I'm going to warn you. I make some jokes. They sometimes don't translate entirely. My wife says I'm not funny at all because she's Ukrainian. So I sometimes say that my only qualification to stand on any stage like this is that it all derives from I'm Ukrainian by marriage. So my wife, actually, Lviv is my hometown. It's my home away from home. My wife grew up about 5 minutes from this hotel. We still have our apartment there. I've been coming to Ukraine since 1999. When my wife and I first met in medical school at Yale, she was one of Ukraine's first exchange students to the United States after the Soviet bloc collapsed. So I've been, coming to this country for 26 years. I've been a part of a Ukrainian family for that time, and I am here to give an award to a very special person, and I'm uniquely qualified to be the one to assess that award because I come from a family of 3 generations of women healthcare providers. So I know what a brilliant, talented woman physician is, and as one of the organizers of the Ukrainian Alliance for Medical Exchange and Development, the key to that is the key word to that is exchange. And we need to have people that can be the bridges between the different countries that are involved in trying to support Ukraine, with Ukraine being the tip of the trident for freedom and democracy in the world. So one of the other things that I don't even think you know this, what my real job is. I'm originally from Texas. I am Texas's cultural ambassador to the world. It is my stated duty to turn the whole world Texan one howdy at a time. So as cultural ambassador to the world from the great state of Texas, I am here to give the Ukrainian Medical Ambassador Award to someone who has been an incredible bridge of this exchange, Kateryna. Kateryna Potapova. Ha ha.
Thank you.
Ha ha ha. So Kateryna is someone I'm not gonna try to even describe her. I'll just say she is a force of nature. Kateryna has been one of the core domains of what we've done with the Ukrainian Alliance for Medical Exchange and Development. One of the ways that Nelia and my wife and many of us who were organizing this was through our core domain on working on observerships to bring Ukrainian physicians to the United States, to come to our hospitals and experience the way we do medicine, which is, very sometimes different, sometimes very much not as good as the way Ukrainians do, because that's one of the points is we actually learn a lot from Ukrainians about the way they do more with less. And Kateryna is one of just emblematic of that as one of our early observers that came in one of the programs we've done, that you can ask Kateryna to get anything done and it's done. So you are our ambassador.
Thank you, Doug, so much. It was very hard to keep the secret, as you can imagine, so we had to improvise. Improvise. You managed to do that. By the way, Kateryna, when she was at observership program, she had 3 months as a trainee at neurology, and she shared her experience of taking care of multiple sclerosis in Ukraine. And she came with a 3-year-old son and her mother who helped her. And it takes a village to a village to raise a child. It's such a saying in the USA. Especially, it's common about female physician. I also have 2 sons. It's very challenging, but Kateryna is very dedicated to her job. Thank you. Thank you. Just a few words, and we will keep following our program. What has been mentioned at the introduction about female, which support other women, and talking about the statistics. If you ask successful managers, prime ministers, or those who have such positions, they said that 2-3 women played key roles for them reaching those tops and goals. So I am inviting you to join our initiatives because this networking may be useful for you. And when you have coffee breaks, every time you have a chance, you can talk, exchange contact details, talk about projects, create projects. If next year someone wants to participate to this event, wants to become a partner, please ask me. And in the case of air alarm, we have a shelter -1 on the -1 floor. Please do not ignore the air alarm siren. So we will continue following our program. We have a pretty busy schedule. Anastasiia Shcherbakova will be the next speaker. She is a facts expert on gender equality, human rights, justice, and the representative of World Health Organization in Ukraine and support of female leadership in Ukraine. So welcome. Hello everyone, dear colleagues. I'm very happy and grateful to be here today. And thank you for your time. The Bureau of of World Health Organization of Healthcare prioritize gender equality as an organization of United Nations as a priority for them and for us. And we work on supporting promotion the idea of gender equality, and we are trying to implement the tools of its integration. And we are working on setting the goals for gender equality. And I would like to pay attention to 2 key. It's a counteraction to discrimination towards women and girls, and fair conditions of labor, and creating fair conditions at workplace. In among all initiatives implemented by Bureau of World Health Organization on creating safe labor conditions, I would like to pay attention to 2 aspects which I believe may become very useful tools in order to promote and support the gender equality at your work. First, it's a vocabulary of terminology on gender equality and human rights and justice in healthcare system. Recently, we published this dictionary.
I hope that this QR code works and you will be able to access the vocabulary. We have we have 500 terms, both in English and Ukrainian. This is a kind of glossary with definitions, and there are examples of the use of these terms. And I think it will help you in your communication when you speak on the topic of gender equality, human rights, and justice in the sphere of healthcare in Ukraine. And another very important product This is a policy or mechanism of responding to harassment and gender discrimination. I am sure that everyone is aware that the notion of glass ceiling and sticky floor are known to women in this hall, and I'm sure a lot of you have faced that. These are the signs of discrimination in the workplace. In order to have gender equality in the world, we will need about 134 years. That's a pity. We will not see the final outcome, but it doesn't mean we don't have to work at it. So that we will have these outcomes for the future generations of women, because we represent women and it's important to us. Except apart from discrimination, gender, because of the gender segregation, as Mr. Honchark mentioned earlier today, we have unproportionate representation in managerial and leadership positions. WHO has its own statistics and research, which is called men manage and the women execute. And according to this statistics, 80% of medical staff globally, these are women. And depending on the country, they take up from 25 to 5% of managerial position. If we talk about nurses, there are 80% of women in this sphere. In Ukraine, this percentage is even higher. Sorry, excuse me. All over the world, it's 90%. In Ukraine, it's more than 90%, according to the latest data that I have. Even in this sphere, we have gender inequality when it comes to salaries. Women get 91% of salaries that the men get in similar positions. We can see how much work we still have to do. When we have this segregation and discrimination, there is this power, this balance. And when there is power inequality, there will be abuse of power, and it leads to violence. And one of the forms of this violence is sexual harassment. To address these issues I've been discussing, this is harassment in workplace, in the medical sphere. We have done some measures. So we did the assessment of the situation in Ukraine. We did the desk research. We analyzed the data and the current figures, which showed how topical the issue is in Ukraine. It is present all over the world, and not only in Ukraine in medical sphere, but we focus on medical sphere in Ukraine to understand the context better, to work towards the solutions and implement them. On the basis of the analysis we did, we analyzed the best practices of the European countries and Australia. Having analyzed the policies that are used in those countries, and based on the Ukrainian context, taking into account these best practices, we have developed a framework to counter and prevent gender discrimination and harassment in the healthcare sphere. We have initiated an implementation project. We have done some workshops from medical universities where their representatives have reviewed the current practices and will be helping them to implement these best practices locally. Medical universities, these are the places where the next generation of medical staff is being formed. Of the This is a place for experts, so they will be the part of forming the future culture. That's why we decided to start from the young people, so that we will be able to change the current negative behaviors and fight current issues, but at the same time, we'll be working with the medical institutions. We will have a series of events for representatives of healthcare facilities. These events will take place online, and you are welcome to join them. Our Facebook page has the announcements. Will have the announcements to register. You can join these events, and you will be able to become the ambassadors of this initiative in your medical facilities. If you are interested, you can see my contact info here. I will be more than happy to give you my business card. I will be happy to discuss the possible cooperation with you and the support that WHO Bureau will be able to give you if you are interested in the changes that I've been talking about. I think I'm running out of time. I'm really thankful for your attention, and I'll be more than happy if we are able to cooperate in the future. Thank you so much. Thank you, Miss Anastasiia. Thank you, WHO Bureau in Ukraine. GMKA is working with WHO in different domains, and there was oncological support assessment under the auspices of European Union. And the findings that we have will be published on our website, so you can follow us. And when there is policy, structure, and documents, and there is the place for inspiring words, I asked the technical team to turn on the video from the Nobel laureate, Miss Oleksandra Matviichuk. Please. My name is Oleksandra Matviichuk. I am a human rights lawyer, and it's my pleasure to address you. I document military crimes during the war that Russia initiated against Ukraine. While the war is making figures out of humans, we return the names to people because people are not figures and their lives are important. We have more than 87,000 episodes of criminal crimes, of military crimes, and there are a lot of women and children mentioned. We cannot victimize women as only women because we are also the people who are fighting the Russian aggression as women. Women are part of the armed forces. They take political decisions. They document military crimes. Women save people under the Russian fire. Women coordinate volunteer initiatives. Women are at the forefront of the fight for freedom and democracy because courage doesn't have gender, and everyone can remember such cases. I would like to share the story of my colleague Viktoriia. She traveled to occupied areas to secretly collect info on torturing and murders of the civil people. She has disappeared. She was kidnapped, she was tortured, she was secretly moved to Russia, and she was kept without any uh, official blames. She was not provided with medical help. She weighed around 30 kilos, and we still don't know how she died. Russians refused to return her body for 6 months to the despairing parents, and when her body was returned, we could see the signs of torture, and there were no eyes, the part of trachea, and the brain was missing. Viktoriia was really genuine. She was courageous, and she was devoted to the profession of a journalist. She believed it was her duty to stay on the occupied territories to report on the truth what Russia is doing to people. She believed that the truth will force the international community to act in a different way, and that she will be able to help to save thousands and thousands of lives. And even though Russians killed her, they didn't prevent us from believing into her cause. And I would like to finish my message by inspiring you. Women should support women even from the pragmatic point of view, because the freedom that we have shouldn't be taken for granted. Our freedom is very vulnerable. I always remember our meeting with the ex-minister responsible for gender equality in Iran. Women in Iran can be imprisoned, raped, just because they wear the clothes in the wrong way. Can you imagine that at some point a woman could take the position of a minister? So that's why our freedom shouldn't be taken for granted. We make our choice every day, and we need women to be supported by women in different spheres. And we are paving new paths in different spheres, because the new path maybe will be used by our daughters. Thank you. It's so complicated to keep back the tears, uh, but we need to continue. And I would like to give floor to Miss Ulana Suprun. She's acting deputy of the Minister of Health. She's a public figure, the editor-in-chief of ARC-UA, and the acting director, and also invite Inesa Huivaniuk, the acting director of GMKA. Greetings to everyone. Yes, it is so difficult to switch to another topic after the previous speech. Miss Ulana, if you allow, I will share a short story and then we'll move on to discussion. I was thinking, as a real woman, I was thinking what to wear. I have the same T-shirt as Miss Ulana has. She gave me it as a gift. Once, together with Miss Ulana, we were at the event that was attended by the medical personnel. Not all of them were really progressive and did not support gender equality. I shared this with idea with Miss Ulana. I thought maybe there would be some uncomfortable situations at this event, but Miss Ulana told me everything would be okay. Don't worry. And she came to this event wearing a pink shirt. I was wearing it because you asked me to. I was trying to find something pink. Uh, but thank you for this support, the way you supported me, and thank you for supporting GMKA. This is a short story to shift to a different topic. Now, closer to the topic of today's dialogue on medical diplomacy. This is a new topic for me. Miss Ulana is more experienced in that, and I will try to direct our dialogue uh, towards the advice for young specialists, women specialists, and what we can learn from you. For the wider audience, medical diplomacy is an instrument of using healthcare system for international partnership, for developing international initiatives between the government and NGOs. This is just for you to understand what it means. Miss Ulana, what is it for you, this medical diplomacy, and when did it start for you? Thank you. Thank you for your invitation. Yes, it was an interesting conversation after we had this meeting. Today, we heard in the morning what medical diplomacy is. We heard it from Miss Zoya, who is dealing with medical diplomacy, or also our ambassador who is doing it. And we've heard it, this notion like ambassador, diplomat, and so on. For me, medical diplomacy are all these things that Inesa has just mentioned, but just because in our country we have the war, there is an additional responsibility uh, of our medical ambassadors and it is our responsibility to demonstrate that we are not only a country at war, but we are also a progressive country. We did a lot of steps in medical reform and in promoting our medical system, healthcare system, women in healthcare system, and we should be speaking more positively about ourselves, that we should avoid being victims, that we need help, please help us, but also we should focus on the fact that we have something to share, the way our colleague mentioned, that they learned a lot from us and Ukrainians learned a lot from us, from them. And this is really so. I can see it globally when I have speeches and have meetings all over the world. When I speak there about our medical reform, the first thing is that they are quite shocked and quite impressed because they're impressed with the fact that we managed to achieve so much during the war, because the war started in 2014, not in 2022, and we started our powerful medical reform during the war. Ukraine was among the countries that was selected uh, by Chatham House. I'm not sure what that is. Chatham House is a thinking tank of the Ministry of Foreign Affairs of the UK. Chatham House selected Ukraine as an example to demonstrate how during the crisis situations you can introduce changes in the healthcare systems. And we are one of the 5 countries in their report that managed to do that. So everyone all over the world know about us as a country. Also, WHO are speaking about our medical reform and in some other countries. For me, I've been doing medical diplomacy since the time when I was in the Захист Patriotiv organization. Now I am not doing this on the behalf of the state, but on the behalf of a person who has certain experience. And when I travel all over the world, in any country, whether it's in the US or the UK or in Belgium or in Germany or in other countries where I'm invited, where they want me to share about the knowledge of the to share our Ukrainian experience, the majority of them have never heard about it, and they always think that this is. They always think Ukraine is a third world country that is at war, and they don't know more about Ukraine. And number three, we we have done what they all want to do but haven't managed to, and this is very important for me. Medical diplomacy is about how we can represent Ukraine as a capable country which is developing and which the one that is ready to be a partner, not only a recipient of their aid. We as women who can leave the country because men cannot, we have this responsibility to do it at all the steps of the way, whether we go to the medical conference, or maybe we go on holiday, on vacation, when you are having lunch in a restaurant, when you are enjoying the beach holiday. You are responsible to initiate the talk that are around you and talk with them about what is happening in Ukraine. Not it's like we are poor and we are at war. For example, say I am a doctor from Ukraine, this is my job. We have this and that. We did this and that. We have to do that every day. This is a kind of synopsis of what I wanted to say. But I would also like to continue on this topic with Inesa regarding the name of our conference. So, women, these are
Many years, the voice, female voice, wasn't heard. And now we are translating a book which was written by Carol Gilligan. She was one of the first who started talking, writing, researching why women were not heard, and why we as women are changing our voice when we are in a professional area. Instead of being ourselves, we are trying to change, to transform, and have this voice which we think men want to hear. And I would like to encourage each of you for you to remain who you are, be who you are, to have your own voice, not some different voice which you think somebody would like to be heard. So the name of book is in a different voice. And that research showed, big research done by Carol Killigan and her colleagues, that when they were talking, and it was about female doctors, that one doctor was standing and she was speaking in front of a big audience, and they asked her a question and she answered. She was like, she's answered in the following: if I would talk on my on behalf of myself, I would do it in this way, but I would do it in a proper way. So but she didn't talk on behalf of her way, what she thought. We Ukrainian women know what kind of our voice is. You have told me so many things, I heard them. A lot of things have been changed because you changed your voices. Even Inesa told me, and others, like young women who go for training, they are not confident in English or how they should behave in a different environment because, for example, it's in the USA on a different country. I would like to encourage you, and I think that men who moved from other countries, they want you to be yourselves, to be true you. They didn't invite you to cooperate with someone else, to be different. Just be yourself. Be brave enough to be yourself, as each of you is an ambassador, and all your country looks at you and wants you to be strong, for you to be brave. I don't really like the word courageous, but it's a little bit about sounds about more about men, but your language is okay. If you harm, when I was a minister, we have a lot of like feminative suffixes in Ukraine. I'm encouraging you to speak your voice, and we are as Ukraine, and you are as Ukrainian women. We are a voice of change. Now all world is looking at Kyiv, not only about medicine. I'm talking about international community who is deciding how the new world will look like, because the world has changed. Even in the country I was born has changed. Europe is changing. Our neighbors are changing. The world is looking at Ukraine. You've seen when our President Zelensky went to the USA, all European leaders followed him. In 2 days, me as a minister, I understand how difficult it is to organize for a president or minister leave the country. It takes 4 months to plan the schedule, but they did leave their countries. They were waiting in the corner when Trump was meeting Zelensky in order to come and support us. Can you imagine what it means for us? We are the center of the world, and you, as ambassador of Ukraine, who are in the center of Ukraine, you have a big duty. and very high respect from your colleagues who travel to different countries, who you cooperate with, who they represent international organizations. I will not tell you what you have to say because you have your own voice. You know what you have to say. You know how to work with others, help each other, each of us. So it was a pretty long answer to a short question, but we'll keep talking. I invite Inesa. I would keep listening to you. You remembered about the voice, and when Zoya was receiving an award, she said that. It's not thank you from just me, it's a thank you from my team. So the female voice wants to support the teams to show a common efforts and achievement, because the common efforts can always win. It's my reflection to what you have said. You also mentioned that you're dealing with the medical diplomacy before, during your position in the ministry, and after. Could you compare your experience? What's easier for you? What's more difficult? And your feelings when the war started in 2014, we initiated the organization. We called the organization Protection of Patriots. We called our volunteers and military. We passed first aid kits. Everyone knows about them now, but tactical medicine term didn't exist in 2014. In those years, diplomacy was about an internationally role. The world didn't know about war in Ukraine. Nobody knew about our needs. Our voice was not heard in those years on a serious level. Diplomacy was more focused on military area. With the Department of Defense of the USA, Ministry of Defense of Britain. It was a cooperation with organizations who wanted to provide aid. It was abroad, but also there was domestic diplomacy. We had to convince our Minister of Defense and ministry and all other ministries that it was a training for military who could save their lives. It was important. So it was like internal and external diplomacy. The second phase, when I was in ministry, it was about representation of our country. So when officially was representing Ukraine, when I was like act in duty of minister at conferences, I always addressed our Ministry of Healthcare and asked them about the talking points. What was the key for them? Because it was a representation of our country, of Ukraine, official. Which things are important you would like me to mention on international conferences? So they passed the information to me, and I talked about our medical situation, issues, needs, successes. We talked with other ministers. It was more official and limited. It was when I left the ministry, it disappeared, and now I can speak openly about those things are important. I think what is needed in our country, because I'm following what is going on, and what that I see the lack of information, where probably I meet people, give speeches, because when I was a member of government or a minister of foreign affairs or minister of veterans, I am a member of government in Ukraine. I mean, minister of healthcare. We had a lot of them. Maybe it's the reason, but the ministers of healthcare, they only talk to other ministers about healthcare, not understanding that the member of government can know more than only his area. So let's say today I'm leaving earlier, and if you want to talk to me, I'm leaving at 2 p.m. You have time by 2 p.m. I will go to Moldova as observer in the elections, and as an ex-minister of healthcare in Ukraine. So when I'm in other countries, when I say that I was acting duty of minister, their face expressions change. The level of my meetings goes up, and it has a very big impact. The bottom line, you have to take part in state agencies. I know that many of them look at you, looking at those state agencies as what you wouldn't like to see it. But there are many others who took part, who worked in state agencies, and it helps to increase level when you want to become ambassador of our country, of our medical area. Our expectations and our successes. So this is changing. I had less influence when I was in the organization of protection of patriots on the state level. It was about international relationship on a very, very high level, but I had my own constraints. But that I was at state agency helps me now to keep developing the medical diplomacy on that level to help our country, which I really love, a country which is suffering from war. Because today, when we had a minute of silence, when we heard from Oleksandra about terrible things which are happening, we are supporting our military, our boys and girls who are now men and women, they are adults. But we are supporting them and they are supporting us. They understand that they are standing at front line to protect us, for us to keep developing. Why should we protect the country which doesn't want to develop? There is no goal in that. It's our duty to develop this country. And when the victory comes, the boys and girls will come back to this rural area. It will not be rural anymore. We have to show them what we have done over that time. We have to show them our results. Thank you, Miss Uliana. I have to remind um, about timing, but Miss Uliana will be here by 2 p.m. You will have a chance to talk about with her. So gratitude on behalf of me and GMK. Thank you for dialogue. And I hope you will wear this t-shirt for elections. For you to know, the future is female. Was invented by my husband, Marco. He's the biggest feminist in the world. And we can laugh at it, but he seriously is feminist in his heart. Sometimes he asks me from time to time if he treats me well enough, how I can support you more. It's what he asks me. I wish each woman to have this kind of a partner, husband, or have colleagues who are around you. And yes, we are team. We are together. Women want to work together. It's a healthy, psychologically way to work. Those who want to join to this, the t-shirts you can buy, and it will support the development and growth of Ukrainian narrative, because we are as medical ambassadors. It's like one area, but we have many other areas. We have also a big culture area where we have to be ambassadors of our culture of Ukraine. Thank you for such a fruitful conversation. Pay attention to this book. The microphones are not working. Now I want to invite the lecturer of Kyiv Mogilянsk Academy in Inna, who will talk about formation of politics to implementation, forming of an interaction with the society.
Good morning, everyone. So many great statements. Good morning again. This audience is a bit unusual, but I will try to get adjusted to look at all of you. The previous speaker, some of the previous speakers mentioned that he specialized in Ukrainian because his wife is Ukrainian. I'm not also a doctor, but I have some personal relation to this healthcare system. So I will talk about my work, but in relation to the medical sphere, hoping that after these events, after we will be talking something that we will talk about today, more women will be ready to be part of politics, of co-creating the future, because it will not come true without your involvement. When I was preparing for the speech, I asked my husband, what do you think? What shall I say to the women doctors about politics, and how shall I inspire them to join the politics? Because sometimes medicine and politics are completely opposite domains. And he said, I have to cite him, tell everyone that cows do not give milk. You have to take milk from cows. That's what he said. So let us say how this taking milk from cows should take place. And when we talk about politics, how can we work towards the how can we work to how can we become the part of the politics? I will start with my experience. There was one bill that I was lobbying, and it was adopted later on. The strangest the strangest bill, actually. The essence of the law was that we needed to change the dash for comma in the document. So in the Texas code, there was a resolution that humanitarian aid shouldn't be text, and also the participants of the fighting. So these are active combatants, veterans, and some other categories of people that has relation to the defense and so on. What it meant in practice, this dash that was indicated in the text meant that you could give humanitarian aid and not to pay taxes, only to those who have the status of the active fighter. It looks like it's logical, but if you think further, like for example, a man or woman is mobilized, they go to the front, they are already traveling at the front, they cannot be combatants as yet, but this person already needs help. For example, to buy uniform, to buy the first aid kit, to buy a tourniquet, and so on. So this person already needs aid before they become active combatants. But the person, according to the legislation, could receive aid without taxation on as soon as they are combatants. It goes sometimes even when they are already active combatants and veterans. Sometimes it's difficult for them to get the official status. But the logic of this law was that if you are an active combatant, you have to pay the taxation. It meant that a lot of NGOs that provided humanitarian aid were forced to find people that had official status. They gave it to those people, and then this aid, humanitarian aid, was sent to other people without the official status. It was like a profanation. It created problems for NGOs. They were constantly worried that they would be inspected and that they would be pushed and pressurized that they give humanitarian aid that shouldn't be getting it. That's why that was a long intro, but the point is I had to change the dash for comma, because if you have it looks like it's a very small change. I think it's the smallest change in the parliamentary history, but it was necessary for the big amount of people to decrease the bureaucratic workload. It looks like it's very simple to change the dash for comma in the text. It's really obvious and understandable, but it wasn't so, because volunteers who worked with that, they raised this issue for many times, and each time they raised it, the Ministry of Finances said it will come to the losses from the budget. All levels of officials were mentioning it. We talked about it with many officials, but nothing was changing. And in the third year of the war, we had this old document. After that, we spoke with some volunteers and decided to push for it. We prepared kind of informational campaign and so on. And inside the parliament, we worked with around this issue with a lot of parliamentarians. We explained why this change is important and so on. The round of public discussions, communication with media, and so on. We submitted this amendment to more like than 20 bills just to push it through. And finally, it was voted for. It was a big holiday for us. And a lot of representatives from NGOs were really thankful, and they said that it simplified their lives. This is a short story of success story, but it lasted for about 4 months, not actually too short. This is just a short success story, but it contains some key points that demonstrate when the change of the policy can be successful and what are the. So people from the bottom should be ready to raise the issues up. So there were volunteers that faced the issue, and instead of thinking, well, we will try to deal with it anyway, they decided to change it anyway. Point two, the problem was clearly formulated. We gathered data, we used some figures. Also, there were some people inside the system, and here I join in to Ms. Ulana's message that you need to have some internal participation to push your initiatives through. I had some colleagues who were the counselors. Also, public communication. Whether you want it or not, you can only be successful when you communicate publicly. Otherwise, it will be almost next to impossible. And another important stage was to coordinate efforts among all these stakeholders, volunteers who raised the issue from the bottom up, then the parliamentarians, journalists that have joined in. And as a result of coordinating these efforts, we managed to change the dash for a comma. I think these are key main reasons, preconditions for success and how we should act. So I would like to encourage you that regardless whether you want to have top positions or whether you want to be just good doctors doing their job well, you still face some issues, some problems that annoy you. Maybe you would like to change something, and it's important to remember that you can initiate everything, that you can launch the sequence of changes. It's up to you. We need someone from the bottom who can signal to the top that we do have an issue. So that's another important insight. I think that very often people that are watching politics from a side, they think that there are mature people that are smarter than them and that they are authorized, more authorized to take decisions than them. Bad news is we are all mature, we are all adults. We have some uh, enough expertise to be worth to be heard. We deserve to be heard and to be listened to. And without that, you people in top positions will not be aware of the issue. So people having top positions, they are still people. They are not gods. These are just usual citizens who have these positions and perform certain functions, but they will perform better if they can hear your ideas. Bad news is that there are no people that will know about your issues if you do not voice them. And the good news is that you can communicate it and there will be proper solutions. Moreover, it's important to remember sometimes it seems like I don't want to get involved. Maybe somebody else will make this decision instead of me. You know what? From my experience of 10 years in politics and 6 years in the Supreme Council, people who want to take decisions, there are extremely many of them. But the point is, the majority of what they want to change are not representing your interest and the interest of your patients. In order to change it, everyone has to speak up. And those who really want to change it for the better, who want to develop the countries, they have higher chances of being heard. People in the parliament who want to decide things there are more of them than those who want to find a solution to tackle the problem. And in order to have a kind of fighting chance, we need to involve those who want to tackle problems that are topical for the whole of the society. Otherwise, those who are fighting for their own interests will win. Next, I really believe in the fact that people can change the society through communication. This is my next important point, insight, and message. Once again, in 10 years of politics, I was convinced that you can achieve success and results if you talk with different people. Sometimes, when I was very active in certain processes, I have this kind of idea. I talk about it with everyone, literally. I talk about it with everyone. So I talked about the story of changing dash into like everyone. And because you never know which communication will result in support, in which case you will get real initiatives. I also, one of my spheres that I'm focusing on is education, and one of the biggest projects that I'm working at, these are issues of reforming the discipline of the country's defense subject in the 10th grade of school. Maybe your children have felt already some changes, but when it comes to the defense of Ukraine subject, I've been doing it for 2 years, and I think that people will quickly start avoiding me, because I speak with them about it all the time. Once I talked about this topic to some of my acquaintances that deal with communication. After that, in 2 months, they approached me and said, "Well, Inna, you talked about this defense of Ukraine subject. We really feel like relevant to that, and we talked about one organization who is ready to reform the curriculum in this subject." And they supported this idea. They wanted to get involved as well. So I would encourage you to communicate, build partnerships, please, find new contacts, network, because nothing else will change the society if you do not unite and gather around the ideas while communicating. Next, what else is important when we talk about forming a policy, creating a policy, and working in the sphere? Oftentimes, you will face misunderstanding. Sometimes you will face hate. Sometimes you will fail. And actually, you will fail more often than be successful, because management of the society and changes, this is something uncomfortable. You have to force other people to act in a new, different way than they are used to, and it's complicated. It's easier to act in a usual way, but it's not impossible. And here I would come back to my example with the defense of Ukraine subject for schools. This is a gigantic project, tens of thousands of people which are involved. And sorry for getting so deep into this issue. You all studied at schools and you studied this subject. It had different names. It was like defense of Ukraine. For women, it was the basics of medical knowledge. After that, I don't know anything about medicine actually after this learning this subject. But anyway, we had this discipline at schools, and children used to be taught how to march and read the statutes of the armed forces of Ukraine. How would it help to defend Ukraine? This is not that obvious. How marching is related to defending Ukraine? No direct connection, of course. And of course, we had to do something with it. We needed to change something, and there were so many volunteers encouraging us to initiate changes. I was involved in this process through, again, this process of communication. I was involved by Marina Berlinska, who he thought that we needed to teach children how to fly UAVs, drones. And I was like, well, that sounds interesting. We can try. And that's what I have been doing it for the second year. It seems like that you have to stop marching and reading armed forces statutes. Looks like it's not difficult to initiate that change. When there are smart people around, they all agree with that. It doesn't mean that it's easy to manifest, to implement. Why? Because there'll be so many people who will say, well, we had been marching for 20 years. What's the issue? Why can't we stick to it? There will be too many people that would say it's a necessary skill. There will be teachers who will say this is the only thing that we can teach. We can only teach the children how to march. We cannot teach other things. Moreover, one of the innovations, of the radical innovations that was offered, lies in the fact that boys and girls have to study this subject together. I cannot describe you how much I heard on that topic. My favorite citation is that girls cannot fire. Girls cannot fire because their fingers are not strong enough. I'm not joking. I have this quotation citation. It was officially recorded from the teacher, one of the teachers at schools. So I can see that I made the Prestai family smile. I think this is my main success right now. And they are saying it's impossible. So what can you do in this case? Option one, you can say, well, maybe yes, they are not strong enough. That the simplest thing is just to push back, yes, or you can try to convince them. You can communicate, and you can teach. Those teachers work in a different way. And one of the things that I am proud about, this teacher who said that the girls have weak fingers, he came to one of the trainings that we organized. He approached my assistant and he told her, you know what? We have girls and boys together, and girls fire better than boys. It was like an eye opener for him. 2 years ago, he could not just think this thought. He could not kind of break himself, to get involved in the process. There's so many, and it he created a lot of obstacles as well. But in 2 years, finally, he uh, realized that uh, girls can use weapons better than the boys. Even this is this is also to inspire you that you women can do perform even better than men in certain spheres. So during this process, the most complicated thing was to teach people to behave differently. This is to provide new knowledge, to be involved in disputes, because people are used to things, the usual things. It's easier for them to move along the typical pathway. It's not like they want super great results. The change also always involves some discomfort for everyone, right? So it's always about, involving some problems. That's why you shouldn't step back when you face opposition and resistance. It might be uncomfortable, inconvenient. You can face some personal offenses. You can face hate, but still, you have to think about it in the long term perspective, like 10 years from now. What people will be thinking about the situation in 10 years? Will I be proud if I step back now, or if I pursue what I want, and if I give the opportunity for this situation to evolve? Another important statement from my notes that I got confused with. My next insight is, I genuinely believe that changes can be made in politics only if you believe in those changes genuinely. Again, there are different policies, different approaches.
We are talking about the changes which you do for better, for society, for general well-being. And here it's very important to work what touches your heart. As I mentioned, when you're in politics, you have to talk about that all the time. If you don't do it, it means that it doesn't touch your heart. If you don't wake up in the middle of night and have some idea, maybe send some message, and your colleagues switch off phone because of your messages at 9. But I think that there is something in your life which drives you or annoys you. They are like kind of triggers if you have it. So try to change it, try to influence it, if it's something small. But if each person tries to change something small on his or her level of department, hospital, so on, the world will be a much better place. Because democracy works when each person works. Ulyas and Inesa talked about medical diplomacy, and part of diplomacy, it's what I have to deal with. It's about advocating of Ukraine, saying that we need to support Ukraine. Ukraine needs support who fights with the Russian territorial regime. And I often hear that you don't have elections. What kind of democracy you are? I have a short answer. And I'm asking, does Russia have? It doesn't make Russia a democratic country. But the truth is that democracy, it's not only about elections, it's one of its aspects. But in fact, democracy, it's about when each of us will participate in different processes, will have a possibility to talk, participate. It's my call to you to remember about those changes, which are not going to happen only on the highest level. They will happen when each of you will take part, and it will be useful in a practical meaning, but it will show the world that we are a democratic country. As in August, such kind of like Maidan saved our country, that protest which we had, we saved that image of Ukraine as a democracy, because many people went on protest because they cared about the destiny of Ukraine, and I saw that it helped us a lot, because in all information in mass media, they asked us about problems about democracy. I told them, can you see the people in the street? They see that they are protesting? They are the democracy of Ukraine. That's why I'm calling you for making changes, being part of process, not only the politicians. And it's important to remember about that. And to end up my speech, I would like to remember the story of defense of my country. The problem is that comparing my work with the doctor's work, very often I get nervous because you, doctors, you save the patients, you see the result. Me, as a politician, when I work with the laws, make some laws, it's very difficult to see a result. And it's also about why people are not eager to participate in making laws when you don't have an immediate feeling of changes. And that's why it's more important when you work in education. When in education the process is very long term. 2 months ago, I was told a story when people are very tired, want to give up. And I remember one story which happened in Vishnev, near Kyiv, where they started teaching the defense of Ukraine at schools. And part of this program is also the changes in teaching medicine, like pre-hospital care, and the children did those training according to the new program. There was one case. Car was going along the street and hit a pregnant woman. A pregnant woman was lying on the street, many people around her, and nobody knew what to do. And some teenagers from the 11th grade were passing by who 6 months ago did that course at school, and they were the only one who knew what kind of care to provide to this pregnant woman. So they stopped the bleeding before the moment ambulance arrived. This woman survived and the child survived, and it happened because children did the course. When I heard this story for the first time, I was very, very excited. I was overexcited because um, hardly ever you see the result as a politician. But it doesn't mean that it doesn't exist. It doesn't mean that you don't have to keep working. That's why take part. Don't be afraid to talk and take away the milk from cows. Thank you, Miss Inna, for being with us the first year and second year. It was a very interesting speech and talking about the state influence on reforms. Oksana, she is the head of subcommittees of modern technologies of the Committee of Government of Ukraine. Thank you. It's a pleasure for me that I've been here second times. We've been at war. The force we are at 4 years at war, and medical system also is like at front line as our defenders. And today we are going to talk about the female leadership, and we are going to talk about the women and our voices, which have to be at front line. Probably today it's not very interesting to hear about and listen to stories about politics, not very exciting topics, but they are very important. As Inna mentioned, depends how we see the results of her work, and at our last event we saw the results, and it was about transplantology, rehabilitation, and we see that now during war these areas work in a different way, and Ukrainians have a possibility to do the um, plancy like within Ukraine, and it's thankfully not just the politicians, but to those people who are here at this conference all together. We made it possible for having this kind of operations in Ukraine, for opening new rehabilitation centers. It's what we talked about last year. Today, I wanted to say that this other forum is about the female leadership, and it's important for me to talk about like as a member of parliament, doctor. I've been a doctor for 20 years, and the last 6 years I work as a part of a government, and we make laws together. I want to say that leadership. It's not only a position or status. Leadership, it's a responsibility and possibility to make very important decisions. Sometimes they are unpopular, complicated, but we make them together, and the women play a key role. I understand that sometimes we need to work more to show our expertise, and what was mentioned by Inna. We need to spend a lot of time to be heard, that we say right things. It's our achievement. Don't keep silence. It what makes us stronger. What we are going to talk about today, our medical system. It's working 24/7. It got used to work like this. And today we faced such kind of problem. It's like a human resources. Yesterday we talked with the Sergey, and he asked me if it works, and a lot of doctors they come to visit him, and he asked me if we have enough doctors and medics in general. And it's what I want to talk about today, about human resources. We talk to military armed forces of Ukraine who also need to hear us, and it's not easy, but we keep moving forward. There is not enough medics in civilian medicine and at front line, and we need to balance it. You know that medics were like reserved for 50%, and now we have 100% of reservation. Did it solve the problem? No, because when the command says they don't have enough medics in civilian life, we also don't have enough medics, and we are trying to like a call for those reserved doctors, and we received like a request to court because of this, and it's difficult why we should call for some and shouldn't call for others. When in December we had 50, I made a law about a rotation. It's what we are going to talk about. Medics who are at frontline since the first days. They cannot come back home, work, because they've been there since first days, and all initiatives about laws. It's about communication at frontline when I go there with military doctors. And recently I was told such a story when I was in Kharkiv region, asked them about medics. They said that everything very bad. They said we used to have a nice surgeon. He was working non-stop, very nice person. And we see that he is exhausted, and we let him go 1 week. He came back and he committed a suicide. And we have such cases. The main problem is when you go to hospital and the doctors say we don't have like neurosurgeon. It was a big problem that those doctors were sent not as medics but as fighters. We solved this problem. We showed this issue to the president, and he made changes. So medics can only work as medics at frontline. But the question is open. We need to balance this in civilian life and at the front. And now there is a discussion as we keep moving, and this mechanism of rotation was offered, which is about fair, transparent rules and timelines. So the person has to understand the medic was mobilized. He will sign the contract from 6 to 12 months. The timeline will be discussed with the reservation of his main workplace. The medic will come back home, and for 1 year and a half, he cannot be mobilized again. So such medic will be mobilized. The person has to know that he or she will come back when and on what period. It's very important question. It is in the process of a discussion. It's important to give the mechanism of rotation for those who work as medics from the first day. I've shared a very small information, like tiny introduction. If you have any proposals concerning rotation of medics, I would be very happy to hear them, because we discussed that with the military medics. It's important to hear the civilian medicine, because this process needs regulation. Also, I want to say as reproductive health care. We gave a possibility our defenders to save their reproductive cells. There is a possibility to do it, and it's important to talk about that. This initiative was started in Lviv in 2022 when we talked with the doctors, when we were discussing what initiatives we might start, and we solved the problem with the telemedicine. We gave possibility to the doctors from Kherson and occupied areas give license to work. So there are a lot of initiatives, and then we started talking about reproductive medicine. When a military said that their cells could be frozen, reproductive cells, and we realized that our fighters are fighting for our future, but we have to take care of their future. And this law works. All defenders at the National Guard of Ukraine, Armed Forces of Ukraine, state border units, they have possibility to save reproductive cells, and in 3 years after the end of war, if they can make decision who have to who to pass these cells. Such initiatives are very good. They also appear in process of communication, but there are also some manipulations, and the laws are not finished as grandparents want to take these cells and decide what to do. That's why we still have to work with the laws. We also need to update it, adjust the law, and the difference how it worked before 2024 and now, how it works now, it's the same, but it happens much faster. We need to respond much faster for improving of our medical health system. A law, it's not just a text, it's what can protect a doctor. It's a tool which can make our medical system stronger and systematic. We have to understand that we have to make laws not locally, but think about our future. It's about reproductive health, rotations, telemedicine. We have to do it that way, which will be useful for us in future. We see that the demography in Ukraine is getting worse and worse, and it's for future. It's for women need to remember about that. Talking about women, that our voice is heard, and such small statistics that 70% of women in medicine. And it's important for our women who are the strongest, the loudest. It's not about being gentle. It's about having possibility and having a duty to make decisions. That's why I want to say thank you for this event. I will be grateful for your suggestions. Maybe you have some new ideas for medical system in order for our Ukraine to have a good future and use.
Let's give the floor Oksana Mykychak. She is the coordinator of psychological health, and she's also the advisor to the ministers of health of Ukraine. And her topic is mental health as the basis for resistance. Good morning, colleagues. I'm really happy for the opportunity to be present at this forum. So talk about with you, talk about the leadership who is in public service. It's very interesting for me as well, because in life I have devoted a lot of time to public service. I prepared a small presentation, and yesterday I decided that I have to illustrate what I want to deliver. So it's well, like it says on the says 100 years in public service. Of course, I wasn't in public service for 100 years, but my professional experience is split into two parts. So there are four. These pictures are 40 years apart, from a rural doctor to the deputy of Minister of Health in Ukraine. I was the deputy for 3 years, and I'm happy to see many colleagues from the ministry. For example, Olana, Miss Ulana, Miss Oleksandra who used to work as a head of the department. So we have great representation from the ministry, and it will be also supported with figures. By working in practical medicine and having a public position, I have certain experience, and now I want to focus on a woman, on a leader who is having a public position in management. Uh, I would like to give you the definition what is public service, and not only as being a state official. These are also employees of self-governance bodies. These are representatives of management in defense sector of Ukraine. This is a definition from some official documents. And these are those people who have selected their profession as it's like representing and representing the interests of the state and society. So the key features of public service: it is done on behalf of the state. It is aimed at defending the interests of the society, is regulated by special laws and additional acts. It has presupposes more rights and duties, and it is also financed from the state budget. To say honestly, when having such a young audience in front of me, I would like to ask you: would many of you like to be in public service? Can you raise your hands, please? Just one, two, three. And still, I'm happy about it. I thought that nobody would express their interest. Among those who were in public service, I think there are less people who want to continue this public service. Women leaders are demonstrating a special leadership style. It is sensitive, it is collaboration oriented, and this leadership style is especially important during the crisis, because it demonstrates it helps to fight insecurity. I'm really happy that I was able to work with women leaders in the top positions. I'm really fond of Dr. Ursula von der Leyen, who is a doctor. She is an obstetrician. She has 8 children. She's a famous politician of modern times. She's a genuine friend of Ukraine. She's a person who is supporting Ukraine's interest on the global level. She is a perfect example of a woman leadership stemming from medical sphere, and we have some mental health programs that are funded at the initiative of Ursula. I am happy that I also was a part of the government, and I enjoyed also working with the first lady when there was the introduction of the mental health program. At her initiative, it leads to social transformation and shifting making it psychological support as part of typical services and expanding this network of centers with such services when people need psychological and psychosocial support. I am also fond of the work. I want to pay your attention that today in the government there are not so many women working. The situation is much better than it used to be in the past. Back in 1990s, I started my public service in 1996. I then returned to medicine and then came back to the government as well. So the situation is changing, but among all the ministries, two or three are the deputy ministers. There's only one ministry when there are no single woman in the management team, and the biggest amount of women are the Ministry of Health. Actually, this is pleasure. There was a period in the ministry when there were women were the majority of deputies as deputies, and this impacts the style of work, the team spirit, and so on. This is a bit more complicated for the minister, who is a man, to have women deputies because the style of work is different. I would like also to draw your attention to women who are managers in the medical sphere. They are represented as the heads of the departments, and we have unprecedented situation. Among the 25 departments, regional departments, 17 are headed by women. We have never had situation like this. I remember the time when there were no women at all. Then there was 3 women. It was back in 2008 and 9. There were 3 women directors of departments, and now we have 17. What does it mean? That women take on the responsibility during the times of crisis. Women are the bright example of transformational leadership. During the war, women managers and the directors of medical facilities and all the women that work in the medical sphere and also the men, but we are now focusing on women. They take on and took on the responsibility, the great for coordinating the activities. So putting together the work of different structures and medical facilities, people became the driving force of implementing different programs, including the national program of mental health, which is important for our resistance, for our survival, and our moving towards the victory. It means that women leadership is not only important, it's just critical for resistance. And these pictures are a great illustration of that. I'm happy that I used to work with these women and continue to work with some of them after I am not only in not after I'm not in public service anymore. We as women in politics during public service we face many obstacles. It was already mentioned today by the speakers that we have this glass ceiling. This is limitations to in access to top levels. This or that decision can be taken, takes a lot of time to be taken because you have to convince the colleagues from the team that these decisions are really important. Sometimes we have a double download. This is combining professional and family duties. This is quite exhausting, and in many cases, it leads to the marriage discontinuation. There are a lot of negative stereotypes, and we know that the net support networks are not enough. Women are tend more to suffer from the burnout, and they are sometimes often after the additional inspection, and there are additional pressures during the public service. I have a few practical cases that I would like to speak about. What does it take for a woman to be in public service? I'm running out of time, but I will try to be brief so that I don't want to repeat the experience that is not necessary. I will just present a sample and select some interesting, more striking cases. I would like to say about the collaboration between women and men in public service. I was really happy. All the achievements, all my achievements happened thanks to the men managers, but at some point, weaker men appeared who could not bear the pressure of women leadership, and then they use women as a tool to do harm to women. That's why there is a kind of lesson for you, for young ladies. Look for support in men, among men, but work with women more, with your colleagues who haven't, who aren't aware as yet that the woman's place is not only in the kitchen. Women are very good managers. There are a few slides demonstrating leadership when weak managers are scared of leadership. For example, when you work at the changes implementation, you can have a lot of women who are women of weak man managers. They are blocking the decisions. And again, it's about communication. If you don't have allies in media, you lose communication. And the best ideas lead to the fact that you have to move aside. It's already 5 or 6 years after I did reorganization of children's hospitals in Lviv. So the colleague from the Lviv regional administration is smiling. This is already a success, and I'm happy that it happened even at a price that I had to leave my position as a department director. Secondly, this is about creating the hospital district in Lviv region. We were the only oblast to Ulana Suprun to create one hospital district, not one, two, or three, but one. And we are supported with by ministry. I am thankful to Oleksandra and others, but you cannot imagine how complicated it was. Now it's working in the whole of Ukraine, and it's again demonstrates how important it's not only to have the status on authority, but for a woman to um, argue, to provide arguments and justifications that the offer decision are worthwhile taking them. The story of Alina's evacuation, it's about how taking this or that decision can impact someone's life and how it is important to go beyond your basic professional duties. There is Arman Kucheryan, the medical director of the National Cancer Institute. At some point back in 2022, we created Medivac team. It was about cooperation with the EU. Well, the first days of March of 2022, Vasil Strilka got a call from the Mykolaiv hospital, and they told him there is a young woman after the missile attack. She covered 2 children, and we cannot deal with her. Help us. When we saw the picture, we didn't know what to do. And there was this my first act was I called Robert Kolonkovsky, who is emergency medicine coordinator, and in Poland, in 18 years, we coordinated Medivac to oncology institute abroad, where Professor Maciejewski together with colleague Professor Krakowski, did a unique operation that was awarded the operation of the year of reconstructive surgeons in the US. You can see this picture, this public, you can see the results. This is a unique result. Today in Ukraine, similar operation surgeries are being done. And thanks to this unique experience that Ukrainian surgeons have. But back in 2022, to provide Medivac from Mykolaiv and abroad, and then there was a plane. Vasil Stilka was talking about the targeted Medivac. It was we had to take corresponding decisions, and that's what we did while working in the ministry. Can you become a leader in public service? Yes, it's real. And here there are recommendations: be professional, take on responsibility to develop networking. But the most important thing is the team. You have to take care of your team. You have to form your team, and by working in the region and the ministry, I paid close attention to creating a proper team, and I'm happy that after in many years I keep I stay in touch with the team. This is the example of the School of Successful Medical Manager. This is a project to teach future managers and current managers. When I became a young manager of regional children's hospital, I lacked a lot of knowledge. I didn't know how to deal with it. So the first thing as the head of the department, I created a kind of school. It worked for 4 years. It had a lot of useful workshops.
And it helped me to create a very successful team which grows, develops, and I'm very proud of that school, which has led a lot of leaders who are nowadays. And one of workers of emergency service in Warsaw. I couldn't stop working, especially with the highest position. So it was a conscious decision. I understood that after that high position, I was not ready to go back home, but cook and stay in the kitchen, cook borscht. That's why me and Oleksandra, we created coordination centers of psychological and mental health, and the connection with the ministry was preserved, and with the Polish we made a great project. About 700 medics of emergency service did training in Poland on and ambulance. It was about safe work. It's important that our women, these are doctors and paramedics, they got the knowledge of profession, like how to prevent professional worn out. Just even about these photos from our events. How many emotions we had, and those people, women from different regions, Kherson, Zaporizhia, how these women were talking to each other, and they were learning Ukrainian. And it is very painful when Polish asked me why my colleagues spoke Russian. We Polish could not understand if it was Russian or Ukrainian. That's why it's important to remember to female doctors about that. Talking about the culture of health, but the female leader should have a responsibility, take care of culture of uh, female health care, to widespread the screening programs, because very often we are delaying the examination, and the care of health is not very popular among Ukrainian women, as they are always very busy, like housework, family workload. Sometimes it could have a negative consequence. That's why it's important to remember as a leader about the culture of personal health. Psychological and mental health skills, it's a key component of resilience, and resilience is very important for our victory. And the work with this resilience is our contribution in surviving of our country. And the work in this sphere is an invisible part area in our everyday work. And female leaders have to implement different programs of self-care, like risk management, stress management. And to sum up, I want to say that just life being at a state agency is not very easy, but we don't have to devote maybe it all our life. But it's a very unique experience, responsible work, and I invite young women. Students, don't be so pessimistic to state to work in the state institutions. It's a very important job, and it was very time when the people at these jobs were like treated like enemies. But one man told me that it was a quote that state which doesn't take care of state agencies has a chance has very high risk to lose its independence. That's why we have a lot of problems with the state services and agencies. There are a lot of international support projects. But there is a generation of workers at state positions who finished their work, and they have unique experience and they can share this experience. It's important to use it. So one more problem in our society, which is getting more and more important. It's about the aging problem. So the female leaders, when they finish their work like me, they shouldn't leave it. They should keep working, keep being involved, providing counseling. Sometimes, yes, you can't spend your time with the grandchildren, but it's important for our future of our country. Thank you, Miss Iryna. These applauses confirm how inspiring your speech was.
Gemma Bowsher, she is a radiologist and scientist from King's College London.
You, the community of Ukrainians, and particularly, I must say, Ukrainian medical women, are leaders in the world in the agility, the adaptation, the speed, and the positive environment of collaboration that has been created in so many of these projects. And it's been so impressive for us to watch this. So here, I'm not here to teach you about how to do this. What I'm here to do is hopefully invite you to work with us and to take all of this knowledge around the world, because you are the experts in this area. But Richard and I and other colleagues, we've worked around the world, and I think there are some lessons in terms of building the partnerships that I think are important for us, and that really show the value of taking the knowledge that could be transmitted through medical diplomacy elsewhere. Some of you are in this picture, actually, some people in the audience, and some of you may recognize some of the people in this picture here. This is a picture taken in London last year, I think it was last year, well, many of you will recognize some people, the Deputy Minister Ihor Kuzin, our program manager here in the crowd, Kateryna, and many other friends and colleagues. And they came to the UK on a study tour, a biosecurity-focused study tour where we visited laboratories, universities, medical institutions to try to build this connected knowledge. And at the foundation of the work that my research group does is the understanding that in today's interconnected world, health threats cross borders, and no single institution, no single person can solve them on their own. The challenges are simply too great. And in many settings that are experiencing conflict or fragility or crisis, where local capacity is under strain, that collaboration and combination of knowledge and expertise can be the most productive way to advance better outcome, to use funding that's available, to get more funding for the key areas, and to raise the awareness of critical issues. But from our experience working around the world, it really is not a one-way model. We find the benefits are hugely reciprocal. So one of the key dimensions of the program that we have been running in Ukraine is delivering training around biosecurity and biological incident response. But we have also learned a huge amount from your expertise. And I think when these kind of collaborative reciprocal models can be developed, particularly, I must say, when they involve women, who I think are perhaps, we're primed to have this more sharing approach, that knowledge can avoid these extractive models of research and of development. So we like in our group to collaborate, and we invite you to collaborate with us over however long the coming years. So I mentioned that we have worked all around the world, and the majority of our work over the recent decade has been in the Middle East. And obviously, there have been several conflicts and crises in the Middle East. And much of our impression showed that women were very vocal. There was a strong women's voice, but their leadership wasn't being elevated to be able to affect the change. And so we did a paper on this. You'll recognize Richard's name here, my name, to look at this problem. And we found that although 40% of humanitarian workers in the Middle East in conflict settings were women, they made up fewer than 3% of the leadership roles, which we took the view was unacceptable, essentially. And so we came up with some recommendations. And those recommendations involved increasing advocacy, specifically saying that women needed to be at the center of decision making, because women are disproportionately affected by the impacts of conflict in terms of the burdens on keeping the regular systems going, managing then the families that also have to exist. And we recognize that when women help each other, society and communities improve. And that's particularly true in medical communities that benefit enormously from women taking this strong leadership role. So we developed a program called Women Leaders in Conflict and Health. And as part of it, it was to create role models working in this area in the Middle East, to promote different kinds of leadership styles, to try to socialize the idea that you could do leadership differently in challenging environments. And that there was also a need to strengthen the evidence and the research basis for this, to prove the case, so that we don't have to keep having this conversation everywhere we go to try to justify the role of women, that it should be natural and understood to everyone involved. Of course, the evidence base is still limited, and it feels ridiculous almost having to do research to justify what we all recognize. But nevertheless, that's where we are. So we have produced a number of papers on this subject, and if you'd like to speak further about it, very happy to. But I am very conscious if we wrote this paper about Ukraine, it would be a very, very different paper. That there is no lacking of strong women in leadership roles in Ukraine. In fact, the majority of people that we have had the privilege of working with have been powerful women in leadership roles, and it's a real lesson to the world. So here's just a few reflections on the partnership aspect. And partnerships is what we do in our group by default. It's easy not to think about it because it's just core to the type of operations that we do. But strong health partnerships require that management of different roles. And so I think these are some principles that are important. So of course, equity and shared ownership. I think it's really important that you design projects from the start to ensure that all partners share in the decision-making process. Making sure that those relationships are trustworthy and trustful, that you have strong relationships that are transparent and you can raise concerns in a positive way is really important. Flexibility and adaptation in the kinds of environments we work in is key. But part of that is also recognizing that there's a huge amount of local knowledge, and that if we can amplify that That helps build sustainability, that helps build the capacities everywhere, both in the countries we're working in and in our own settings as well. And we try to monitor what we're doing continuously, because we're very conscious that what worked yesterday may not work today, the conditions on the ground may change, and something needs to change. And that we try to have the reflexivity in our process to change what we're doing and respond. And that's very important. There's no point just barreling through with rigidity. So these are just a couple of the projects, and I will just take you through a selection of some of our projects very lightly, and we're very happy to talk more about this. We have projects here, mainly on here from the Middle East. Here, this was a large project that we did in Turkey, Lebanon, Jordan, and in Palestine, really focused on non-communicable diseases, mental health, and the political economy of health, trying to understand what the structure of healthcare looks like in these quite challenging conflict settings. We're just coming to the end of a long project in Syria, in northwest Syria, which was an opposition-held region in Syria over the course of pretty much the entirety of the conflict. And these involved enormous networks of partnership and trust in these very, very challenging environments. These are more thematic programs we have focused on One Health. So the connectivity of the environment, animal health, human health, and trying to understand those connections. And we do a bit of this work as well in Ukraine now. And of course, we've spoken about, and you heard from Richard, about much of the cancer work that we're doing, which transcends boundaries of conflict and humanitarian settings. Another project that we're running is focused on the issue of disinformation. At the beginning, maybe a week after the full-scale invasion, I was approached by the Canadian government, and it was clear at the time, obviously, that there was a huge amount of disinformation focused at the Ukrainian public health laboratories. And there was also a lot of disinformation focused on the medical system, and that persists today. So the Canadian government contributed a significant amount of funding to address the issue of chemical, biological, radiological, nuclear, and medical disinformation in Ukraine. And that's one of the programs that has kept me coming in and out of the country over this time. It's now being extended for another 3 years because they're pleased with what we've done. And we've been able to partner with many organizations, both government agencies, public services, but also non-governmental organizations such as Vox Ukraine. And we regularly contribute to meetings at the parliament and with policymakers. And I think it's really important that us as a medical and a health-focused research centre are able to contribute to these discussions and partnerships that reach a policy level, the political level, because that's where the decisions get made. And that's where some effects can be had on challenging problems that have health impacts, but that don't necessarily emerge from within the health sector. And so we recognise that we have to be adaptable as medical professionals to take on different skills, to respond to new problems in the 21st century that require us to be open to what's required in our jobs. I'll just play a very short video. It's a promotional video that we have. Hopefully it will work. So as part of this project, we've been able to work with medical schools, medical professionals, laboratories. And part of that has been recognizing that disinformation targeting medical care, healthcare, public health has real world impacts on the system and on health outcomes. I don't need to teach this to you, but what's important is that we build the capacity of the professionals, the doctors, the medical students, the lab professionals, and the women working in these centers too. So we've been privileged to travel around many medical schools now in Ukraine and other facilities doing this kind of training. And we've also been able to work with fantastic organizations such as This is Vox Ukraine, who we have now have a very good relationship with, who have been able to tell us when they see campaigns occurring, new narratives, and then we've been able to try to coordinate. What do you do about this? Where is the place you intervene? So I regularly attend the meetings of the Biological Weapons Convention and the World Health Organization and the Chemical Weapons Convention to refute these allegations, to counter and deny these campaigns that continue to erode the trust or the integrity of the medical system here in Ukraine and internationally. This is a summary of some of the work that we do. And I think it's just to show you that the variety is enormous, but it takes this kind of adaptation. And bear in mind, we're a medical group, right? So by background, we're a medical group, but this kind of adaptation and this taking on of new roles and skills and approaches has been really important to this work that we've been doing here. These are some of the meetings. I'm sure you'll continue to recognize some of the people in the pictures in Ukraine and in other meetings in the Biological Weapons Convention at the United Nations, for example, and in the Ukrainian Parliament. More training. Some of you have been at some of the trainings, so I'm grateful to you for listening to me once again on this subject. And most recently, we are establishing a new program. So we were running a program as part of USAID, which is obviously no longer. And now we're building and consolidating all of our relationships with partners in Ukraine and with our program manager over here, Kateryna Denisenko, to deliver a new program that covers key areas of biosecurity: viral sequencing, viral illness, bacterial illness, biosecurity training and education, and strengthening and building the program of non-communicable disease management. And we spoke a little bit about this yesterday. So I invite all of you to join us on this journey, on this new program. It's always a pleasure to be in Ukraine, to work with you and to build these partnerships, because there's so much expertise here, and it's always I learn more than I every single time we come here. So some practical tips, I think, for building effective partnerships anywhere. Seek the partnerships that align with with your priorities. So find the institutions that really are effective in your area of interest. And there always are some. Now, I mentioned Vox Ukraine, or here, the Center for Counter Disinformation, or so many of the medical schools we've identified here have been such fantastic partners. And be really open about that negotiation of roles and decision-making within your partnerships. That should be open and transparent. For us, mentorship is really important, and specifically to build and join together networks of women working in these areas, recognizing that kind of adaptability and capacity that can be developed in cohorts of women in these environments makes all the difference. It's clear to us that gender imbalances won't correct themselves by accident. So it's something that has to be done actively, with energy. So whether it's finding out what the root cause of the problem is, it has to be done specifically. It's not going to happen by accident. And as I said, when women help women, when women elevate women, and when women are elevated, we make society and communities better for everyone. So it's a real imperative. So I invite you to tell your stories about these kinds of activities that you've been doing. There's so much amazing expertise in this room, and sadly not enough time to hear everyone today, but it's been a fantastic day, and I'm really grateful for the invitation to speak to you, and I look forward to many more collaborations with all the women in this room, and the men, of course. So thank you.
Speakers are incredible colleagues of ours. They are our partners, and all their projects inspire us. And I would like to present the next speech will be from Viktoriia Tymoshevska. She is the co-founder of Fund Healthy Solutions for the Open Society, and Tetiana Havrysh, the co-founder of the NGO Solutions again for the Open Society and ILF company representative. Yeah, I can see already that you have had some coffee. You feel so energized and refreshed. So, healthy solutions for women's leadership through the joint common values. Greetings, dear friends, ladies and gentlemen. It's our lucky second chance to give our speeches after the coffee break, but we are thankful that you have come back and that you are coming back. We are thankful to GMKA to have like a stand up, not a speech this year. It will be a bit unusual role for us because not that often we are focusing on women's partnership and leadership, and this presentation stimulated us to reflect on what this partnership is about. Viktoriia, maybe a few words of greetings before we move on to the presentation. I'm just taking some time while everyone is coming back. It's my pleasure to be here, and I'm happy to join in to the speeches. This forum is about two things that are always present in my life. This is number one, medical sphere, because I'm a doctor by education and I have been a practicing doctor. And secondly, it's about leadership, because a lot of things I've been doing, they this is making empowering women's initiatives through different activities, in particular financial support of women-led organizations. We will talk about healthy solutions for the open society, about our NGO foundation, and we want to give you more practical context to inspire and stimulate you to do something together, both in commercial sector, in professional sector, and NGO sector. At least we have a lot to share with you. Who are we? Healthy Solutions for Open Society. This foundation was founded back in December 2022 by the International Fund Vidrojenia Renaissance by two of us. This is actually our full name, Healthy Solution. This is our this is health, public health in its broadest meaning. Also the maintenance of human capital, and also something that we have inherited from the Renaissance Fund. This is open society. This is empowering NGOs, especially in the health care sphere. We will shortly speak about our activities. They are quite broad in comparison that were typical for the NGO health solutions from the past. So Pani Viktoriia has been heading the organization for 15 years. You talked a lot yesterday about medical self-governance. We were really happy to hear that, because this was introduced by our fund as a narrative, that we are happy about it. And this topic is discussed by medical community as a critical point. This is the result of our common work. Viktoriia, maybe you will focus on some of the our other activities. You can see here an important topic of women's leadership, and we continue to support uh, health solutions by offering scholarships for masters in the School of Health Management at Kyiv Mohyla Academy, together with the Women Fund, together with Canadian government, we support the educational courses for women public activists, not only connected with health and medicine, but we also provide them with understanding related to funds management, budget management, advocacy, how to get funds not only from donors but from other sources to fund the ideas that women have in their communities, in their professional communities as well. And also we are talking that we foster the support, the mental health support for women, and it is included into our women leadership initiatives and healthy community initiative as well. I would also mention about military medicine initiatives. This is a component that was born in our foundation right after the foundation started working, and we talk about this topic more broadly than just providing tactical medicine or first combat medicine aid. It's also about women's health that are serving in the armed forces, and those practices that have to be introduced so that we have the gender balance and equal opportunities both for women and men combatants. Also, we are specializing on research. One of them is Health Index. This is a separate project. Maybe you have heard it. We do it together with the World Bank and WHO. Health Index of 2024 is available at our site. We will share the links with you. This is not the only research. This is something that we are doing every 2 years. Almost each of these areas you can see in the screen were included in this health index project. Maybe they can be useful in your work. Now we would like to mention a few words about ourselves, to subjectivize ourselves among this audience. So I am the lawyer, Viktoriia is a doctor, but we will talk about it a bit more to make sure that we have the mandate to give you suggestions and recommendations. Viktoriia got the medical education. She worked as a doctor specializing in obstetrician. She worked as an obstetrician and gynecologist, but now she's one of the greatest experts of public health. She received her education in Columbia University. She worked in the public health department in New York, and after coming back to Ukraine, she worked in international institutions, including International Renaissance Fund, and when she was heading it, it became one of the main stakeholders of reforming medicine in Ukraine. I would like to introduce you as well. Yes, I will be very interested. We are joking between ourselves that each time we kind of highlight new aspects of our professional activities. It is my privilege and pleasure to know Tetiana. I have known her for a long time before the health solutions was created. I know her as a person who united Kharkiv expert group. She helped Kharkiv medical community that had both men and women. They formed the center for designing the reform of a healthcare system, and they did the draft. They prepared draft ideas what could be done to shift from the old Soviet Union system, and she did it from the legal perspective. She's also a director of the big lawyers company, legal company that has an important focus on medicine, and she has been involved in transformations of complicated systems by providing a wide legal framework This is something unique in her experience because our usual lawyers are not used to it. They like limiting the framework, and Tetiana, vice versa, she broadens her frameworks in her legal activities. Thank you, Viktoriia. You really validated me in this sphere. I continue. I am the partner of the lawyers company before the full-scale invasion. I was focused on partnership in business, how to leave the partnership as well. But now I just have a small part of this sphere, and now I also provide consultations to women. So I will use my this previous experience. When in 2022 Viktoriia asked me to join this new project, I said yes immediately because, in fact, in my complicated legal business, usually they say that legal business is a man's business. I have been dreaming, if I had a different life, I would have worked in the Renaissance Foundation. At first, I said yes, but then I started thinking how I would do it. But I'm really happy it happened. We somehow complemented each other, and from my side, I would like to say I wanted to be a prosecutor, and I wanted to enter the legal education facility. I also wanted to be a medic, but yeah, during whole of my career, I understood that from the viewpoint of medical education, my professional experience, I worked mainly in state or what is called communal hospitals, university hospitals. And then I worked in international organization. I had this professional bias from the viewpoint of my experience. It was like a narrow niche in medicine, and in this within this paradigm and framework of the communal uh, company or business or international organization. And inside, I felt that international experience from the viewpoint of international business that Tetiana had, and also business solutions, it would have been very useful for the viewpoint of combining when it comes to projects that were launched by either professional associations, medical associations, and donor community, because International Renaissance Fund was 85% as an organization who deals with donor funding. And in that time, we supported, our main function was the support communities, medical communities and patient communities. For 3 years together, we have been working together. We have different professional background, but we work together. Our partnership is not purely a women's partnership, it's like a mixed partnership because there is a third partner, International Renaissance Foundation, who is headed by a man, and the majority of our advisory board is comprised of men, and this is a classical mixed partnership because there are three parties. And now I will just analyze some evidence. But before that, I remembered Oleksandra Matviichuk in her speech. She reminded us about Iran and about these terrible transformations that are going on in Muslim countries. If you are following these changes during the last few years, the legislation has become too tough for women. And I have come across an idea that it is connected with the fact that Ms. Mykychak indicated there are less and less, more and more weaker men. About 10 years ago, I think Reese Witherspoon mentioned that when she reads the movie scenario, they always demonstrate like the woman always asks a man what to do in these action movies. So this trend.
So this is like kind of like an answer for organic changes in the world. It's such a way of man to protect till the last breath. Maybe not, but it's a very inspiring story to teachers who teach how to defend about girls who can't were taught how to fire. It works. So there is a statistics. It's in commercial sector and other institutions which do researches annually, and they learn the partnership and the effectiveness of their work of gender aspect. There are a few facts. Each invested dollar for female partnership or mixed, the return is twice bigger when male is to 35%. It's an interesting fact. Why it happens? It's because women tend to be savers. They less 50% less capital. Their annual month's expenses are lower, which help such partnership, like mixed partnership, to higher level of survivability. Talking about the negative aspect, female investments have lower involvement on one side. On the other side, investors are tougher to women than to men, especially if there are some failures. It's very difficult to get new investment than to the male investments based on research. Talking about Ukraine, the last research I found in 2024, we have such data: 18% of partnership where the beneficiaries are women, 15 are mixed, and 58 only men. Talking about the statistics of survivability, these world trends are all more or less the same. As for now, there is a very big disbalance. What else can we add? That agreements made by women or government and non-government sector work better, more efficiently. They are better mediators and have better negotiations and more involved in the context. And it's the school of culture. So all there are different developments for strategies on communities recreation. We work a lot with women, so the research show that the projects which are run by non-government organizations developed by women have a much higher sustainability than by those projects realized by institutions, international institutions. I think it's an interesting statistics. So you can on the screen you can see a link to this research because it's like evidence based. It's not about solidarity only. So in such way, in all government, non-government sector, female partnership have a better sustainability, more effective, but there is some level of discrimination talking about investments. Talking about fundraising, female non-government organizations in healthcare are more effective, but maybe they have like a less number of investments or less frequent there than male organizations. It's the data from statistics. And the 4,000 organizations were studied. Now we're going to talk about Ukraine and to our partnership, which our partnership is mixed, not only male or female, but the management of the decisions happen that we divide in between them, between ourselves when we share our roles, and some coming outs might be useful for some of you when you decide to start a common project with a female manager, and you will try to remember this story, how we find the solutions in a conflict and how we make decision. Because as we developed the organization over the last 3 years, we have developed our fundraising how to say level. It's a result of a very difficult work, emotional, intellectual work, the work on development, because we both have changed a lot in the partnership. Before we start sharing our stories, short stories, but interesting for you, I would like to add to what has been mentioned about partnership research. There is a high level of researchers how women make decision. And as you remember, Miss Iryna said that in fact the women combine many roles in the roles of mothers, professional roles, everything which is related to children, like their holidays, school, clubs, and family management. So what I want to say, I don't want to say that about topic that a woman takes care of family bonfire, but sometimes women have to make more decisions than men, and it is proved because many administrative and operational things at work and in family depend on women and expected by society to be done. I can add, as I have did a little research on women ability to make decision. It's the same as men's. So I don't believe that we can shoot and fire worse than men or make decisions. But there is a big difference which we should remember. It's about partnership and our physiological, hormonal peculiarities and cognitive and psycho emotional reactions which make us different in some moments of our life where we are tend less or more to risks. So sometimes we can assess some decision like less emotionally but being more radical, and it's about the same advantage and disadvantage at the same time. But talking about our story and how we make decision, I always remember one of our first projects, which where we involved additional investment from international donor about the work of mobile teams of first care in Kramatorsk and in the area. So we were visited by humanitarian organization, and they offered to find investment for 1 year for few mobile medical teams which would purchase medicine, provide training. Like we discussed that with the Tetiana. Tetiana having a deep understanding of importance and using how the knowledge how it works. She offered to have analytical component which will be related to detailed outcomes of legal and financial model of those teams after they run out of money and investments, because we have to take care of sustainability from donors, and it is expected from donors. To be honest, negotiations lasted pretty long, and there was a moment when we were sitting at conference. It was online, and we were saying that no, we are wasting our time. We could find another donors, receive more interesting projects. I don't believe in that. But then I said, well, I will stay talking with them if I waste my time. But I have a feeling that we might reach to the common decision, because the donor was saying that at the beginning of 23 everything was not clear. That's why it took a lot of time, and with the time it turned into one of the biggest projects, and we provided a lot of humanitarian aid to our services, and it enabled us to involve additional investment. It was about trust and about values. I trusted Tetiana that this analytical component is very important. And if I believe that I know how to end the negotiations successfully, we managed to do that. Trust is very important. Um, about those values, which according to the research are the key between female partnership. And when women cooperate, it's much more successfully. Me and Viktoriia were overcoming a long and difficult way, not to be emotional in some moment of making decisions. Once at 3 months, we did sessions for two. We involved mediator in order to transform what has accumulated into lessons. Yes, we have conflicts, we have different visions, but we always come back to our values, and it helps us to stay together. I'll try to sum up and finish what we have mentioned. It's a photo of our great women from Bucha, this family doctor from Bucha, Oksana. Oksana, this is Miss Oksana. We selected this photo because it was the first one from Bucha, and we wanted to show that mainly communities are developing because of women, their contribution. I hope it will turn into influence and quality, what that women will have more political influence, as making decisions by women is important. And we work with the 10 communities all around Ukraine, and now we have to travel to Mykolaiv after this conference, where we will have a conference for communities, and we have two more communities there, and the communities from Kyiv area and Kharkiv area. Transcarpathia, and all we see is that transformation of a female role. But unfortunately, women often do like additional function. However, the impact is much bigger, and in order to for those glass floors, ceilings, tables break down, we need evolution. We depend on the world trends, but sometimes evolution leads to stagnation and personal decision to be brave and do something not traditional way, or we often are afraid that you may fail, and it slows down the development of us all. We want to prove that first of all, that any projects in partnership are more effective than solo project. Believe me, it's according to statistics, but also for another stand up. Female partnership are more lasting and resilient in crisis. They are more effective, and the results are more sustainable. And if a female partnership fails, it can be mixed because the results will be better than in only male projects. So if you could be an additional or inspiring, you can see our information, how you can reach us. If you have some initiatives, you can offer your partnership or ask for advice. We are very open. We have a big team which shares our values, mixed team. We have men and women in our team. Who are those men? Probably are feminists. Maybe they used to be like this, otherwise they wouldn't join us. And we believe in people, and we believe that the values of solidarity are very important. Solidarity is what we all need, and as a result of our nature, women have a unique ability to combine, to put things together, to make these agreements of this kind, which will have future. It's difficult to add something, but I want to say one more time that we are open to partnership. So please, not delaying the next speaker. Our information, we will stay here to the end of the day. We'll be happy to talk to you and plan future.
Thank you so much for your inspiring speeches. Personally, I've been following the activities of Health Solutions for a long time. So please click on the link and have a look at the project Healthy Communities and so on. And I would like to use this opportunity before the next speaker starts speaking. Please join UANet. Can you please share the QR code on the screen? At this link, you can publish materials, or you can find those materials that will be beneficial to you during the following days after the conference, because there will be recording, there will be videos, and so on. That's why please take a picture, and while you are taking it, I cannot. This will be our next speaker is Kseniia Vosnitsyna, but I will tell you what happened yesterday in New York at the initiative from the Bill from Hillary Clinton initiative and Dr. Chelsea Clinton. There were top level leaders of organizations, of big sectoral businesses, civil society, and there were people. People could see our Ukrainian flag where we were presenting GMKA. Do you know Kseniia Vosnitsyna? Do you know Lisova Polyana? And we're saying, yes, I do. That's why I'm sure, including those who have come today because of Kseniia Vosnitsyna, we're so happy you're with us. So she will tell us how to stay psychologically, mentally resistant. She is the director of the Center for Mental Health, Lisova Polyana of the Ministry of Health of Ukraine. So resistance and psychological resilience, practical advice and insights. That's the topic of her speech. I will try to do some therapeutic activities today with you, because together with the team we work with the trauma sphere. We've been working for 11 years. So we have interesting things here. Friends, have you noticed when the humanity and society are under constant stress, and Ukraine is such a country, sometimes they lose the ability to be curious, to be attentive, and sometimes people do not pay attention to simple things. Have you paid attention that flowers have appeared here, and when they were brought here? Oh, someone did. Great. So I will start with an exercise. This is from psychotherapeutic activities. We like to use different therapeutic practices which are evidence-based and which really work. We live in a difficult time, a time of insecurity, pain, loss. We don't know what is going to happen tomorrow, but there are some constant things. For example, it will snow after the winter, spring comes, flowers blossom, children are born. In the summer, there are a lot of fruit, flowers, and a rainbow. Why rainbow? This is a kind of dramatic trick. It's not about LGBTIQ. It's just a rainbow as a symbol of summer, of pleasant emotions, of colorfulness, some pleasant memories. And this exercise is called rainbow in a basket. It's quite long, for 2 or 3 hours when we work in groups. Today we will just do an express exercise. Rainbow is something also which is constant. We will have rainbows even if we have war for a long time. There will be always rainbow after rain. It is often associated with summer because there are no rainbows in the winter. Not sure, but I think so. And so it is associated with the summer and pleasant emotions, and it's now of fall. And I often hear from my patients, when the summer is almost over, when we are expecting the winter, we start to be more anxious. We are expecting blackouts, we are expecting that it will be cold, and we are just remembering the summer. So try to remember what happened in the summer and put it in the kind of basket, rainbow basket. For example, I like remembering when I was in the Carpathians, and there was a couple of veterans, and they renovated their house, and it's now a great mini hotel. So I kind of look through the pictures. I remember this special atmosphere when we spent 3 days there. Maybe someone else wants to put a different rainbow into the basket. Could you please share your pleasant memories from the summer? And try, when remembering it, try to consciously turn back to it. We have a very big group. Yeah, it doesn't work like this in psychotherapy. We should have a smaller group. But please remember about it. Think about something pleasant in the summer which can support you. I will take the clicker, and today we will be talking about mental resilience. And there will be a lot of great things, a lot of beauty, about how we can learn to see beauty and create beauty. Why am I speaking on this topic? I've already mentioned that we work in a big traumatized environment. Our clinic has 250 patients. These are veterans from the front line. These are people who were tortured, who were imprisoned. Sometimes my team says this is a very traumatizing environment, and even if you can hang an axe in the air, because you know this air is so filled with trauma. This is what my colleagues say. This is our professional skill, actually. Resilience is our professional skills. This is professional necessity which we are cultivating. Why am I with an apple? So each slide will be kind of beautiful one. There is a nice metaphor about mental health among the specialists. If we imagine that health is the apple, then mental health will not be one part of it, as for example different systems of organs. Mental health will be its middle part, the essence of it. This is something that keeps us alive and is an important part of our well-being. So evidence-based practices say that these 5 points, if we keep them and maintain them, they will tell you about your mental health. Please raise hands who can complete all these 5 points. So this is sleep, eat, be physically active, have friends, and choose meaningful activities. Who has 3 of those? That's a lot. But yes, keep it up this way. So what is resilience? You heard this word, maybe you know it, but this resilience is about how a person after a crisis or traumatic event can survive, be able to recover without harm to their identity, and also demonstrate post-traumatic improvement or development. This is something that we are fighting for in the field. And why do we have here 2 balls? So this is a Christmas ball. When it hits the wall, it breaks. And the tennis ball, it just compresses and then bumps back. This is another metaphor about the resilience. You have to cultivate resilience. It's not easily achievable. It is typical, you can train it as your muscles, but our muscles will not be proper if we do not train them, if we don't work out. And we have to work with our resilience in the similar way. So I will briefly talk about this, about social connections. This is taking care of yourself. It's not about being self-centered. It's about the choice, a conscious choice that we make and follow that choice. It's about mutual support. It was mentioned today. It's about religious senses. It's about spirituality, something that makes your life meaningful. All these things, this is something that you have to develop in yourself. And I think we are managing it. Have a look how people intuitively find certain practices that they have never used before, and this is something that helps them a lot. Igor Kozlovsky, his book Dignity and Truthfulness, this is like a everyday book for us. So having dignity and be Ukrainian, this is kind of our slogan. We also have a list of values that we are sharing. His book is great. He is a famous religious studies scientist, and he also went through the captivity. And in 18, he was freed, and it was my pleasure and privilege to be personally acquainted with him. And his book, it's really small, you should read it. It's about dignity. When we work with severe psychological conditions, when they have PTSR, when they suffer from depression and anxiety, a person in such a condition, they never feel safe. And a person who never feels safe, they cannot feel dignity. And we are talking about kind of diagnosed cases when we have a severe condition. But what does the Russian Federation do for many years with Ukraine? It destroys its identity and dignity as such. And this transgenerational trauma that you know about, if only to take the last 100 years, there is no a single decade when the Ukrainian nation was not traumatized. And this trauma that is in our society, why are our people not empathic? Why do we take decision? Why sometimes it's difficult to take decision? This is all the results of trauma, transgenerational trauma, and recovering and renewing identity through the action. This will be the ability to save ourselves. I would like to share with you a model that we are using in our facility. This is a model from Israel, basic PH. These are the first letters of each section. This is a model that helps to overcome crisis, and it presupposes that there are 6 channels that the person can use to overcome stress. Sometimes not all of these channels are well developed in a single person, but each person can find their resilience and development through these different channels. I think you can see them. I will not focus on them too much. At least I use at least 5. I have always had issues with physical activity, but I'm trying to work at it. I've been doing my best for the last half a year. Katya, you know about it. That's why, and this principle can be used not only how the person can deal with their everyday stress, but we also use this model in architecture or in design of our space, where each patient can find the location, the place where they can select each of these classes. We have libraries, physical rehabilitation, gyms, we have art space. This is a very useful evidence-based models that demonstrated high efficiency. So please go ahead and use it. Neuroaesthetics, again about the beauty. Today, neurosciences are moving forward very quickly. Neuroaesthetics for the last decade, it has been acknowledged as a separate science institute. John Hopkins Institute, they have a special lab where scientists learn how beauty, music, architecture, flowers impact our brain. And there are a lot of evidence that yes, all of these things impact us. That's why please learn to see beauty. These are not pictures from the internet. Top 2, these are flowers from my apartment. They are always there. I teach my children to have a look at these beautiful flowers. We talk about these flowers. I keep these flowers all the time. I change them from time to time. And the picture below, this is a picture taken from hotel today in the morning. I spent 5 minutes to have a look at this scenery. So try to take breaks, stop, and enjoy the beauty. It really works, you know. Scientists are proving that. Next slide. Organizers shared like a typical presentation, and I could insert a video. So I thought, well, yeah, they give us the opportunity to insert a video, so I'd better find something. I'm telling you how I'm trying to recover, how to work with people. Last week, I've been hunting for flowers for Metromonatic concert. He has wonderful shows of the global level, and by using administrative resource of 5 handshakes, I found some tickets for this concert, and we ended up at his concert last Saturday. And again, it's about beauty, about the beauty of people, music, and so on. And yes, it's about a singer who is pregnant. She's going to give birth to a baby in 3 weeks. It's about it's about special vibes and about people who were dancing. So you have to plan your actions. Of course, you know that I always plan my Monday. On Monday, I plan what we will attend on Friday and Saturday. This impacts your mental health in a positive way. This planning provides you this safety and security and resilience, that you can influence something, that you can count on something. We cannot change the events, terrible events that are going on now, but try to control your life in simple ways. And I would like to ask you, help yourself to a great ginger cocktail. This is actually my so you can see the cocktail one part. This is sleep. You have to have a lot of sleep in your life. I know there are issues with the sleep. Who doesn't sleep well? Please raise your hands. About 60%, I guess. Please, you have to have enough sleep. I always lack this. I try to have 8-9 hours of sleep. My team taught me. They taught me some techniques that helped me to control my sleep. 1/5. This is about food. I don't eat very much right now. Also, half a year I started doing some physical activities. You have to add something that you have never done before. Recently, there was a case, there was a training for investigators who work with people, with families whose relatives went missing. This was a very difficult group to work with. These are families from near front areas. They're in a very bad psychological condition. And when we ask them, what do you do to recover? 30% say, I come home, my husband and my wife do something. No, this is during the times of war when we have such a long stress. There has to be something more. Of course, family supports you, children support you, right? But there should be something more to it. You have to do something additional to overcome, to bear this marathon. It's not sprint anymore, it's marathon. You have to select the tempo with which you move during this marathon. We cannot live the way we used to. So the basis of the cocktail, there is a lot of ice. These are like people around me. I need to see new people. I need to communicate with new people. I need new meetings, networking, maybe going to the theater and restaurants. And cherry on the top, this is something that we mentioned. This is creating beauty and noticing beauty. We have all our trainings in our facility. These are 3-5 bouquets, flowers bouquets around. Our training is about dealing with difficult emotions. We usually have good food as well. When you're at home, burn scented candles, use lipstick, bright lipsticks. Be happy with your life.
And yesterday, Uliana Suprun said, asked me to talk about this, about our female work in medicine. So, or 1 month to the email of Lisva Poliana and Ministry We receive complaints and requests on public information on the director of that center. Looks like should doesn't look like a director should work, especially as the person who works with the veterans. She travels all around Ukraine. She changes her looks, outfits. And then schedule my schedule, what deputies I have, who works when I'm not present. It's been the third request. It a little bit kind of it puts me under pressure. It's like 2025, but it doesn't stop me. It's what I'm going to keep doing because all my patients, all people at front, they are grateful to what we do, to energy we give, and they ask us for our income. So don't be afraid to feel the beauty in life. And the last slide, maybe it will be a little contrast, but again, for me, it's about beauty. When I finish my presentations for the last 4 years, not just saying thank you for attention. In such way, I'm grateful to each of person, and this slide is nice. And my presentation, I would like to share a very simple practice which you can do every evening. It takes 5-7 minutes. Put aside your smartphone. Don't scroll social media. It's an exercise. It's a mindfulness technique. It's very simple. It's called the Glade. It's easy to remember. You have to lie down in bed when you have time, when you have done all your work, worked with children, and you have to think about these 4 points which have happened to you with you. So it's a gratitude. You should think what you are grateful for. Some small things. Something you have done positive, maybe some people you met. Second, learning. What have you learned? Some small things every day. I'm learning to drink more water. I don't know, it's difficult for me to learn a lot of water. So every time I drink a little water, I'm like, it's like achievement for me. Accomplishment. What have you done? It could be small. And the last one, delight. What have you been impressed with? What beautiful have you seen? It's a beautiful technique which I've been doing for the last 4 years. So please use it in your life. I am sure that our resilience will be recorded in the world history, resilience of Ukrainians during wartime. But we have to keep working by flowers and red lipstick. Thank you, Ms. Kseniia, for practical advices. And continue on this topic of psychological resilience, we will invite Beata. She's medical psychologist, the CEO of clinics Neuromed, and she is going to talk more about how to work without fear and manipulation. Good day, dear colleagues. I'm very happy to be a speaker today with you and talk about important topics in the sphere of medicine. And I want to start with saying that every day at our work, we as medics, we are trying to take care of our patients, provide them good quality care. It's not only about the healthcare, but we are trying to create a feeling of safety and trust. And sometimes we are trying to do this, we forget ourselves about a medical environment, safe environment where we work. Unfortunately, harassment in medicine is pretty taboo. and still it is common. What concerns statistics, I will give more details in my slides. But why I selected this topic is because I want to say the importance of, first of all, learning how to see the difference, identify it, what you should do and shouldn't, and taking care not just about yourself, but also about your colleagues and patients. Because sometimes some violence can be a source. We could be doing that, not understanding that it's not okay. That's why today we are going to learn in details the kinds of harassment and efforts of counteraction we can do, starting with the developing of policies in organizations to our self protection. As for the beginning, I would like to offer you short brainstorming. Two colleagues widespread the rumors that Yuri is alcoholic. It's not true. Somebody even created fake photo. Yuri is very worried, and he stressed that his boss might see that photo, and he's very anxious. Who can raise your hand if it's not okay? Raise your hand if it's not okay. Yes, it is a kind of bullying and harassment and cyberbullying. When you're trying to humiliate, it can have serious psychological consequences of that worker. One more case: Mikhailo works as a cashier. He gets some remarks from your boss, and he's told to be more attentive. If you repeat the mistakes, you will have to change the workplace. Is it okay or not okay? If you think it's not okay, please raise your hand. I can see 4 or 5 hands. In fact, it's not harassment, it's an example of being productive, it's a feedback, it's about discipline. There are not harmful or discriminative things. It was a clear warning because in different organizations there are different policies on warning. If you get 2, 3 warnings, and we will have to do the following steps. It was without manipulation. There was no psychological pressure. It was clear, straight, and open. When another case, if an example is angry, he says that his worker is stupid. Then he says sorry, and his worker Sarah is always in a state of fear, who thinks it's not okay. Yes, it's a classical harassment. It's like systematic bullying, even if the person who causes harassment will say sorry, it doesn't mean that this person is not responsible. The thing is that it repeats all the time, and fear means that it's bullying. And if you live in such like emotional, different, like different situations, and when you are told that you have done something bad, you are put down, and next day you are cool again. It's not a normal attitude, and remember, most likely it's not going to be about you. It's going to be about boss and his unprofessional way of communication. Because to work in the system where you work danger, when you expect all the time to be punished and blamed, It's not okay. It may lead to serious psychological issues. In previous slides, we heard bullying and harassment. Bullying, it's when it repeats, often related to it repeats like scaring behavior. It's not about discrimination, and harassment. It's more about discrimination. Harassment. It's what often women in medicine deal with because of their age and so on. It can happen one time, but it can be systematic. So I am accumulated this harassment. It's because of my some like my origin or other things. Have harassment. It could be like when someone shouts at you, rumors about you, interfere into personal things, some unrealistic deadline. If you do this number of tasks, which is not real, then maybe we will promote you. It's another psychological pressure. Or it can be online or offline. Some examples for us to understand how this good communication looks like and not good. For example, you are too attractive to be a surgeon. It's not okay. It's about stereotypes and sexualization. You did well with a difficult surgery. It's okay. It's about a complicated process about your work. It's okay. For example, your look distracts patients without a policy for like a dress code. If you don't have confirmed document how you should look like, can you have like red lipstick, red nails? So if it was not mentioned, you can do as you want. If it has been discussed, it is approved, and there is a policy on that, then they can have some complaints and give you comments because of your look. It's about rules, not about body. It's about rules of behavior, not about your body. So women are weaker. For another case, for night shifts, yes, it's a stereotype. When we plan according to the order, plan our working hours, it is also to understand what is not harassment, because sometimes we can confuse the employer can say it differently when there is difference in thoughts from the vision of putting you down, that your opinion doesn't mean anything. When the boss is always right, it's not okay. But when you have like a one-to-one conversation and in normal conditions, it's okay. When you have like constructive feedback, it's okay. It's a big problem that not many people can do it. When you want to give like a constructive feedback, we have to join this worker. We have to say something positive, at least one thing. For example, you did something well in this operation, but then you say what was not okay. Then you say talk about the point of development. If you say you did everything bad, you have to remake everything. It's not a constructive feedback. It's not what we say, but how we say it, what words we select. to run the productivity and allocate the tasks. It's the task of managers, and it's not about abuse of your position. Okay, also it's okay to say like have a disciplinary policies. There are different kinds of harassment. I will not talk too much on that. One, I put this slide. It's to show that violence is about the spectrum. It's much more than just like some jokes against you or some unpleasant conversation to you. It could be verbal, not verbal, like sexual, discriminative, physical, online power harassment. Even the influence and manipulation of with your working hours might be a harassment. Or, for example, if somebody says, if you do massage to me, maybe I will replace you for some working hours. And harassment is not only in the team, but it could be also from the patients, especially when we work with patients who are not aggressive, disorganized. When medics can become victims from the very patients, in particular women, because they are more often do the role of communication with patient, especially in the hospitals and nurses, unfortunately, and the sexual harassment is pretty high. Shortly, about 3 examples. The most common is sexual harassment, some comments when somebody touches you, and sexual harassment. It's like spectrum. It's not about raping or trying to do that. Starting with the it could end with the cyber harassment. Trying to find the term concerning children. Sexting, or when you do some thing and like service for service. But if it happens in the case of not your willingness to do that, it's about violence. Or, for example, when someone hears like sexist jokes, when someone says like, "Oh, little girl, it's not the place for you to be in a surgery." When the patient insists on a sexual relation to the nurses. It, discriminational harassment. It's about negative offenses, insults. When a female surgery is not allowed to do surgery because she's weaker, or someone laughs at someone's accent. What the power harassment is about, what happens in Ukraine, or what I hear from my colleagues. It's when the manager or senior colleague use his power uh, to put workers under pressure to do what is needed for him. For example, some tasks which are not feasible, or refusal to give vacation. Recently, I heard from a patient who has like a PTSD, that every time when she carries the request to finish to leave the work, he gives her some condition.
So she was asked to go to a corporate party, but she wanted her to wear uh, the the dress. Uh, either you do the way I want it or forget about your career promotion. It's a typical manipulation as well. Why do women suffer more? It's about gender stereotypes. There are less women in managing positions. This is another reason. The bigger uh, the bigger part of women are more in contact with the patients. They have more. They communicate more with patients. They are less present in the during the surgery. Also, the culture of being silent and the fear of being repressed, a fear that I will be evicted, fired, and so on and so forth, makes women to keep silent. Even the fear of being blamed, the fear that you of victim blaming, when the victim is still even more blamed uh, because your appearance kind of was provoking and so on. All of these can be the reasons of the silence culture. When it comes to statistics, there will be the next slide here. When it comes to statistics, as you can see, more than 85% of sexual harassment cases are not reported. Up to 62% of medical personnel have experienced violence in a workplace. This is a very high percentage. There were verbal offenses 58, threats 33, sexual harassment 12%. Figures that are on the top, it's about general. And at the bottom, this is concerning medical personnel. The number is really high. How does it influence the medical personnel? First of all, this impacts mental health, starting from the negative symptoms, anxiety, insomnia, the lack of security, burning out, demotivation, low level of satisfaction, and there can be some physiological consequences, immune system suffers, and so on. Does it influence the patient? Yes. What's interesting, harassment which is present within the team can impact the patients as well, especially if you take care of the patient as a team. If 2 or 3 doctors work together with the patient, if they have bad relationship, if they don't have healthy communication among themselves, it can impact. It can lead to mistakes during treatment and generally to low efficiency of treatment. Let's move on to how to fight it. Here you can see an algorithm for organizations. If you work here as doctors, most probably you will not apply it. This has to be applied by the management of your medical facility, directors, and their assistants. This is assessment. I will not read each of the points here, but in general, fight against harassment should be systemic and comprehensive. It's not about one action. Today, you listen to the lecture, what it is about, and then we forget about it. It has to be a systemic approach, starting from the physical security, surveillance cameras, emergency button, or guards. Also, there can be a response mechanism that has to be confidential, and investigation has to be independent. And the employees have to understand who they can address if there was a case of harassment. They should know that they will be accepted, admitted, and that they shouldn't be blamed. There should be reporting, monitoring. There has to be frequent auditing, uh, trainings for personnel, how to communicate ethically, and so on. Everything in combination will prevent harassment. This is systemic, non-stop work. What are the algorithm for employees? What do you have? What you have to do if you have faced unfavorable behavior? First of all, this is about security. You have to create physical security. You can call a colleague, you can call the guards, depending on the context. So you have to have kind of put the line, put a border. So you have to signalize that your behavior, somebody's behavior is not okay. You can say, please stop it. You have to document it. As much evidence you can take some notes. You can document the time, the place. The more evidence you have, the better, because it will be easier for you to solve it if it's systemic. Why don't investigators want to investigate such cases? Because there is no evidence, because it's difficult to trace them back. Also, take care of your health, and if necessary, address the specialist. Share these stories with your loved ones. And what's important here, if you doubt this behavior, if it seems that something wrong has happened, it means you are right that it happened. If you feel it's not okay, if you feel uncomfortable, but you're not sure if this behavior was inappropriate, don't turn a blind eye anyway. Address people who can judge your situation independent, who you can trust, who you can share it with, to have this fact checking. To overcome doubt sometimes can be difficult, but it's necessary to do, because you turn a blind eye today and tomorrow it can become systemic, and then at one point you will understand that you faced a systemic issue that will be more difficult to tackle. So doubts to the aside. Also phrases that can help you. I am not comfortable. Stop it. This violates the policy of our facility. I will document this incident and I will report it. These are the phrases that you can use. And of course, this is close to criminal, to crimes. It's close to crime. Then the police can deal with it, but this borderline is not clear when there is just verbal harassment, verbal violence, but it can quickly shift into the criminal area. So again, address the specialist, ask for recommendation and consultation. Don't turn a blind eye. And if you have faced sexual harassment or violence or stalking, even online, or sexual violence, it's not about the direct contact, it's even about unfavorable touches and so on, or kisses or hugs. Please immediately report about that to the management, police, and so on. It's great if your medical facility has designed a book like the corporate ethics book or the communication norms, and everyone has to be aware of the rules. And if you have employees, they have to study it as well, and that then they know clearly what is acceptable and not. It's about the culture, which is built not in one day. It's about shaping the right atmosphere, which takes time. But then the employees will feel safe and friendly. Remember, harassment, it's not about some small trouble, it's a risk for personnel and patients. So the culture of respect, high quality policies, and learning and real response they work. So the voice of each of you is important. And the best method of fighting the harassment, this is prevention. It's about everything, like it's a typical principle used in medicine. But prevention, it's on the shoulders of management. For you, it's important to identify, to respond, and keep your ground. Your strength is your awareness. If each of you, if each doctor at least is aware of the info that was presented today on the slide, it's already great because they already will know about it, and this awareness will become a kind of weapon for them. Knowledge is a weapon. Thank you. Thank you, Beata. I hope that everyone is working in a positive environment and this knowledge will not be beneficial, but it's good to have them. I would like to give floor to Yuliana Maslak, psychotherapist. She is the member of Cognitive Therapy Coalition. She will tell us how to support yourself in order to avoid leadership without burning out. I think all the speakers, previous speakers, were delivered really nice presentation, and I was thinking how to combine everything that was mentioned and to show you what is something that you can apply in your life and have ready-made algorithm. I will not communicate something super new, something that you don't know yet, but I think it will help you to feel yourself and identify how you feel in your workplace. When many years ago I started working in a very nice center, the Circle of Family in Lviv, my boss told me that if you're a leader, this is not a person who knows everything, who can do everything. This is not a person wearing a crown who needs submission. This is a person who gives other leaders around them to grow. This is a mentor. This is a person who inspires, who identifies your strong sides and helps you to understand when you make mistakes as humans. So my lecture will be a lot about such things, how to be able to listen to yourself if it looks like it's not real. As Beata mentioned, it might be real. The first thing, maybe you will give me your ideas. What are the typical characteristics of a leader that you like, that inspire you? Just raise your hand and mention. The someone who takes on the responsibility, a strong, a bit masculine or not, or more delicate person. So it's like having a sparkle in your eyes, an ability to move on, having a vision, know in which direction to go. It's very important. This is a person who can see in which direction the team should move and how to align it with their values. And if someone gets lost, this person can help to get that person back, show the right direction to move. Yes, that's right. They can inspire other people with their ideas. When I've learned how to create brands, so the most important thing that I was told, when you burn with the idea, you believe in that idea and you kind of is contagious in a positive way. This is something that helps and inspires. This person, I have it in my slides, something that you mentioned. This is a person who has vision, responsibility, empathy, and it's like being an exemplar, an example. This is demonstrating how to behave. But this is sometimes we want the leader to be ideal people, or is it not so? It's also about expectations. And expectation, this is something that we can see in an ideal situation, but the reality is sometimes completely different or it's a bit different. And this is something like a system of small steps that you do every day. It's also about leadership in your communication, in your help, and so on. There is a very nice African saying: if you want to go alone, you will walk faster. If you want to walk far away, you need your team and the people around you. Remember about that, because it also tells you how to distribute responsibility. I think many people, including you at least you felt loneliness in your life, and it was not connected with romantic relationship. Loneliness can be very diverse. It's when you treat a patient and you don't know who to approach and ask question. It's when you try to take care of other people, but you don't see that your values, your actions are shared. Have you felt this loneliness in your profession? I think it's most painful. It's my like from my personal experience. When you don't have this support, when you understand that that your actions impact health and safety of your patient. But I think the strength, the human relationship is so important for us. Miss Ksenia mentioned it, that people are important for her communication. But it's also about exchanging experience. It's about the possibility to have people who can hear you and help. And Beata also mentioned that human relationship can be very different. We can be pointed, our mistakes can be pointed, but we also can be provided with understanding, support, and help. But loneliness does not is something that is derived from something. It will not be overcome if we cannot find people who will share our values, not like in a sect-like manner, but when it comes to vision, so that we will move in the same direction. So for us as people, it's fine. It's important to find peers when it comes to thinking, when we can reciprocally listen and hear to each other. But the reality sometimes is different. There is big range of issues that worry women, and I will come back to this feeling of loneliness. But when it comes to gender stereotypes, we can see that starting from the leader of the class in school, this is a man, and then the leader of the group in the university is also a man, and it looks like more responsibility is associated with men. And women, they are more about caring, they are beautiful and emotionally more accessible. But I think that women face the struggle when they know how they can do something. They have all the features that are necessary for a leader on the one hand, but from the another hand, they have a number of issues. I forgot the word. It's like you don't want to talk about that, or these are things that you don't want to voice. Sometimes the women have to bear children, they have to cook, stay at home. You go to work not to stay at home. But quite frequently in my worldview and among the people that are around me, it is so. And there are also gender discriminations.
When I studied at medical university, female surgeons was a rare case because they were saying it's not a simple job, except you have to work intellectually. Also, you stay away from home for a long time, and very often, as Beata mentioned, women can have a lot of like sexualization issues, harassment at workplace. These stories unfortunately happen. I also think that one of the key things which I in particular notice from my colleagues who work with the family medicine is about time allocation. When someone sends you a lot of messages, they are endless. You have to do something, and it very quickly it brings to burning out, and it brings leads to clinical conditions, and even have like a suicide nature. Second, it's the system of inequality. Talking about salaries, we know the statistics that women doing the same job have much lower salary. It's dishonest. I'm saying these problems uh, because I want you to know what emotions you have, because very often the leading roles that women are expected to fail sometimes. What will go wrong when someone expects you to fail, and somebody will put extra pressure on you? It's one of the most painful my topic. It's about being mother and career. It's when you want to do these two jobs. And sometimes when I hear from my patients, when I have to take care of my child because my husband goes to work, makes money, and I, as a mother, can make some extra money. But the parenting, it's about the equal responsibility, maybe not 50-50, but at least 60-40 when a husband is a partner, because the decision about the child was made by a father and mother and father, and why women have to pause their career progression. And in medicine, if you stay 3 years at home, my father, my granny was saying that you are going to get stupid because the world changes very quickly, and it gives the feeling of disappointment. And the fourth, it's like chronic tiredness or information overload. You have complicated cases. You're looking for solutions. And despite that, you're trying to keep working. It creates ongoing pressure. If could you raise hand if you had something closer to these four problems in your life? It is common, very common, and it is important to hear, because it means that everything is fine with me. We live in the world which may have different things which are not honest. And I've asked if you had such moments when you were not next to. You said yes. It's a very nice job, and I believe that doctors are those people who love people, who want to take care of someone, who whose the main focus is not money. These are people who have deep values, and to be a doctor is to feel responsible every day. And very often, this responsibility can be too big for us when we are not strong enough. Sometimes it is difficult emotionally. We have to make a lot of quick decisions. And except that, we are not robots. And it's one of key things for us to do our work well. You have to always be emotionally involved. You have to be to treat people with empathy. And sometimes we can have too many challenges and staying alone. Because what the managers pay attention to, two very, very nice cases or to what they received a complaint. And everything what is in the middle is sometimes in a gray zone, not always noticed. Do you notice that? And it is always taken for granted. And we will talk about 4 levels of self-support. And before we reach them, we will talk about risk factors. And I think that all of you understand that it happens when we have a lot of workload, administrative and operational work, when we have an important thing, like when you have to make the best decision for the patient. And sometimes when you have a family and other factors which influence on that performance, we know that the burning out of doctors is very hard, and then we cannot be sensitive to patients. It's not about external factors, it's about everything what is around us, like external circumstances, and we have 2 battlefields: problems we face with every day, like a war, different situations, mistakes, and social roles. And the second battlefield, if have you heard what is internal critic? So those who haven't heard, it's like integrated into our brain messages of adults from the past who live in our head, and they play a role of a trainer, manager who help us to build up motivation, not in a healthy way. It can be 3 ways. It can be like punishment, like it can underestimate very much. It's a person who tells you you must do some things, and it will cause the feeling of being guilty. And when someone says that I mentioned that it was going to happen, and if you have learned to travel around the situations which happen, you will not immediately stop thinking. In the evening, you receive this criticism, and you start thinking about some mistake which you made earlier, and more things. I think that these messages in our mind, the thoughts, and the attitude to the situation is one of the key painful things which take away our energy and resource. I saw a very nice video when a woman was standing and she was told positive things about herself, and for each positive she got M&Ms. She got a full vase of M&Ms, and one small M&Ms was in empty vase, which was told was when she was told that you haven't done enough to be good enough, and when you hear not enough, and all the positive compliments were vanished. So why I say that all our reactions about workload, parents' comments, we perceive it through our experience. And doesn't matter what we are told, we will not do it, not because we don't want, but because we don't believe it. So invite you to watch and try to discuss, like to learn more about this voice of criticism in your mind, who would give you positive criticism when you will think that you do well. Yes, sometimes you make mistakes, but it's okay when you treat yourself with love. With love, be a good doctor towards yourself, not just to others. but to ourselves, sometimes we can be very tough and very demanding. Why I wanted to tell you about that? Because we have external circumstances. It's normal that we feel stress. It's like in archives, when we have positive and negative memories. In, and this frontal part, which gives orders. There is a middle part, which is responsible for fear and anger, and it never falls asleep, and it's like goalkeeper, and always asks you questions: is it safe or not safe? And we don't need to look for extra stress. We feel a lot of emotions. Then imagine that something happens and accept that you have found the solution, but you still keep thinking about the same experience. And for this part of body, it keeps sending you the same signals. And you do the double work. It's like a harm to yourself. What can help us? Of course, we can say that you can see the psychotherapist, but these are also about positive people around us, because we do not always need a psychotherapist. Sometimes they see just our battlefield, because sometimes it's difficult for us to slow down and listen to ourselves. And the first, it's like a personal level. It's not about basic things like sleep, food, physical activities. There are more positive integration. It's this mindfulness, and we have a nice system in Ukraine where we have good experts. It's about a collective therapy based on mindfulness, focused on overcoming stress. When you understand how you respond to stress, and you're learning how to feel it, but also how to lower it. And if you Google, you say just mindfulness, it's not change and relax, it's to realize what is going on with you at this moment, and it's very important for each person. You need to know if you need a break or you can keep working, like micro pauses. It's a very important thing. Otherwise, our brain will keep working non-stop. And these are techniques of sympathy to yourself. It's about taking care of yourself with love and care to what happened if you made a mistake, when you had a big challenge. It's about people's positive attitude. It's how you talk to your children, to your friends, relatives, and to those who are important to you. It's also about medicine, like individual coaching, when we are shown where we spend a lot of energy and where you have to slow down. It's not about psychotherapy. It's a nice model of Ukrainian Institute of Cognitive Behavior. And it's about a lot of things which are important for us to cherish. It's about wisdom, understanding yourself, ability to listen to others, but also resilience. About how to act effectively, not to do a lot, but to understand when more efforts are needed. It's about being happy to simple things when when there is a sunny day. The second level is like a team level. This is like message bulbs of love. It's when you come to work, um, so with those people who will treat you respectfully, you don't have to be best friends, but you have to be on the same page, that these people support you. Then the responsibility will be delegated, and you will feel better. I think it's important to understand what takes your energy the most, and have a possibility to talk to your manager about rotation. If you keep silent, nobody is going to help you. It's to discuss an important question. I think the third level is like organizational. It's about mindfulness of managers of institutions. For example, doctors have to make a lot, like good money, to feel satisfaction. Then they will do their work well. But on the other side, we cannot turn it into just business, because there's always a human component. I'm not a business analytic. My task, these are human emotions, and we need smart managers, but they will be interested in care for patients. They will care to be for team, not to worn out, because you are the most valuable resource. All system relies on you when you do your work well. And the fourth level, it's like social life beyond hospital, when there is some environment where you can share your good experience. There are a lot of systems which work, and they analyze, we know how to deal with that. And it's very valuable to have a mentor who will channel you, who will support you and supervise you in some cases. And the last, very about human behavior. It's you have to take care of yourself, not physically maybe, but emotionally. You will not be a good doctor to people if you are exhausted physically or emotionally. When someone will try to see the support, and in medical process you are leader, and you will channel where to move. There is a partnership, but you will take responsibility and a leadership position for patients treatment. It's important to analyze what takes your energy the most, because there are many positive cases, but still you can be exhausted and burn out. There should be people who can share responsibility, good husband, friends, some good supervisors. So we develop a system of good relationship, because if you don't choose mother or father, we have possibility to choose people who would like to talk to, communicate. It's our responsibility. Who we should be more, who we should have more trust, and where we should have to keep distance. And the last is to have a bubble of love. Not just when people say, "Wow, you are incredible," and when you make mistakes, they say, "I love you," but it's a risky situation. Check it again. The people who will tell you the truth.
Uh, we are all making mistakes, and it's very important to be truthful to yourself and find someone that you can talk with, because we all need people around us. And the last thing, These are questions. They're not only related to leadership, but also about self-care. And I would like to ask how your love bubble looks like, because it's important who you can come up to in these difficult times, but share some happy, joyful moments, because it's life. And apart from celebrating, you have to know how to solve issues. We, as friends, know my friends know that we can dance together, but they also support me when they need to support me. And what little steps I can take tomorrow to take care of myself. And the last thing, uh, leadership is where there is a community and people. Can you see? I have my beads today. These are my great grandmother's beads. They are a big they are rarity, but it is, if there was only one bead, it would look great like this. It's like a team of these beads. If you have nice people in your team, then each of these beads is nice. That's why I hope that in healthcare system we'll have great teams, and so that everyone will feel a leader. And please do not compete, support each other. Thank you. Thank you, Yulia, for great, inspiring expressions. And we are moving on to the panel discussion about the perspectives of women's leadership in healthcare. So please, we would like to invite the technical specialists that will help with the chairs. Thank you. While we are preparing the stage, please, I will announce the speakers. Nella Melnichuk, colorectal surgeon, Harvard Medical School, and also the co-founder of Global Medical Knowledge Alliance. Michelle Hladunewich, physician in Sunnybrook Health Center, Ontario Rental Networks, and also professor at Toronto University. Carolyn Levis, a plastic surgeon, McMaster University, co-director for chair of the specialty for plastic surgery at Royal University, and Kateryna Pavensky, MD, hematological scientist, head of division of transfusion medicine of St. Michael's Hospital, Unity House, Toronto, associate professor in the Department of Laboratory Medicine, Pathobiology, University of Toronto. So please, a round of applause for our guests and speakers. It's great that the armchairs are so soft. This is a very serious panel. So these leaders need soft armchairs. So I will moderate a bit when it's necessary. So my partner Yuliana mentioned she is my partner who has already presented all the speakers of the panel. So without further ado, we will talk about leadership styles. So we will have simultaneous interpretation for those who need it. We will start in a moment. All those that are present in the hall, if you have any questions to our panelists, please raise your hand and ask it immediately. We would like to have a dialogue so that we can have this discussion. We don't want to have like separate presentations. We don't want to look at like a conference.
Yeah, so like we have a lot of leadership styles. So you can find a lot of information on Google or ChatGPT about leadership styles. But here are the examples of successful leadership in both clinical work and NGOs and other things. So Michelle, to start with you, what would you call your leadership style, and was it the same through your career?
Okay, so my leadership style now, I think I would call it much more collaborative. Okay. I find that you get a lot further with people if you're on the same level as them, if you're having a discussion, if you're bringing ideas to the table. When I was a younger woman, I was a lot bossier. Okay. Because I felt there was still a need to sort of prove myself amongst what were usually men at the table. And you don't know me very well. but me being very direct can be very scary, actually. So it was, so I actually did take some leadership training to round out my edges a little bit because I was a little bit too aggressive. And I found that maybe I was speaking before I was listening. And now I'm very conscious to listen before I speak. So over the years, my leadership style has changed a lot. Sometimes old Michelle comes out and I'm a little bit too direct, but you're also allowed to say sorry. Okay. So you should be yourself. You should be authentic. And it's absolutely okay to make a mistake because as a leader, you'll make plenty of mistakes. And when you've perhaps said something in a way where the tone wasn't right or it was misconstrued, it's your responsibility as a leader to also say sorry. So think about creating an environment amongst your people where you are modeling how you want to treat each other, all right? With respect, with kindness, with empathy. And I do think empathy is possibly the most important skill that any leader should have. You know, I'm the physician in chief. So that means people are coming to me with problems and problem behavior too. So I get problem behavior. And sometimes I'll hear the story. I'm like, wow, they did what? And you got to take that out of your mind. Your first question is, what's going on with this individual? So you have to hear their side because nobody in medicine wants to do a bad job. Nobody in medicine wants to be a nasty person or a rude doctor. People have things happening personally in their own lives. So as a leader, you have to have that empathy and you have to listen to that story. You know, in Canada, we get things called college complaints. You've done your best. You've tried so hard to do something well, and some patient writes a complaint and you get a college complaint. And that's when I find it's the most important time to support your physicians with empathy. So always be the type of leader where you're open, you're empathetic, and you're kind, and you have to model that because that's what you want to see happening in your institution.
That was just perfect. Anybody that wants to comment or reflect on that?
Yeah. Why you have? Did you just not hear anything what I said? And they put it in Ukrainian? Oh my god.
Okay, Michelle once more. Now start again.
Time.
I don't know. Is the mic on? The mic
Yes,
is on. I think that's something that specifically resonated with me is that. So I look around and I see a lot of young women, and I cannot tell you how incredibly heartening this is. I see very few women who are of our age or older.
Study.
And we worry that what happened to that entire generation. But I also, thinking back on my career, I can think the time when I would be walking into a room full of men, and I would be the only woman. And I'm in a leadership position, and there is this expectation. And it is true. It is when you're a young woman, it is very important to stand your ground. But once you've been in the career for a bit and you've already earned the respect, then you can afford to take this much more laid back. There's nothing else to prove. So for those of you who are starting out, project confidence. Project confidence and project passion and do not hold back. But it is a fine line for women. Because if you project too much passion, you will be labeled as hysterical.
Why are you looking at me at the moment?
So it is really, really important to measure your arguments. But you should never shy away from the fight.
No, one thing that actually has helped me, and I don't have any answers. I'm actually learning from all the panelists and from Michelle. And me and Michelle actually have been meeting weekly to talk more about our Ukraine work, but I'm learning from her leadership and her style. So I don't have all the answers, but one of the things that has been helping me, so I'm both I'm a surgeon, and now I'm mid-career surgeon. And clinically, as a surgeon, you have to lead. You have to lead in the actually, all the physicians, all the nurses, we all have to lead. But in the operating room, you have to have that presence. You have to make sure that people are listening to you. You have to make sure we are doing the right thing for the patients. You don't want too much noise in the operating room. You want to make sure that you and anesthesiologist are on the same page. You want to make sure that you and the scrub nurse are on the same page as well, because we know that good teams are working better.
Could you please slow down for the translation?
Oh, okay. Oh my goodness. It's harder to talk like that. So I do use humor, actually. I use a lot of humor. And, I know my husband Sergey yesterday was talking about that people can write you up in the hospitals in the United States. But I don't know if I should be proud of that or not. I have actually never been written up. And I think it's actually because of the humor. For example, we had a case where operating nurse, pre-op nurse forgot to inject heparin for the patient before the surgery. Obviously, it's important because patient can develop blood clots. Instead of going crazy, and I was going crazy on inside because it was a long case and I was worried about the patient. But I asked one nurse to give heparin intra-op, but I was standing with my butt right there, and I was telling the nurse, well, just make sure you don't inject me. I know you're upset at me, but just don't inject my butt. So I do bring this up, and I think humor helps, but I do agree with Kateryna Pavensky completely. You have to assert yourself as well, and it's very tightrope to walk. We hope that, for example, when Anastasiia daughter is going to be a surgeon, she doesn't have to worry about what other people think of you and how they perceive you, and they perceive you the same way as a man. But right now we're still living in that society where you have to watch what you're saying, how you're saying, and go from there. Okay, I think I spoke too much.
Yeah, your turn.
Those were all really excellent answers and viewpoints. I think one thing I did initially when I was starting out in surgery and in leadership roles, I tried to assimilate. I tried to blend in, which was difficult because I was the only female in a surgical group and as a surgical trainee. And I had a strong belief that I was the same and men and women were the same. And that has changed over the years. We're not the same. We're different. We have different styles. Fortunately, we have different styles. And so I have evolved by accepting that when I'm in a leadership role or on a team like we are here, I lead or behave and function what comes organically to me. I follow my principles, my fundamentals in the leadership role that I have, and I don't try to pretend that I'm not the gender that I am. I am who I am, and I have the style that I have. And I would say that is where your strength should be. I think when we try to be somebody that we're not, that's where, when you're not authentic, and when you're trying to portray something, you aren't going to be at your best. You're not going to deliver the product that you're skilled to do. And so that would be my synopsis of how things have evolved for me. And it takes a little bit of experience and some confidence to say, this is how I lead. Whether I am female or male or whatever I choose to identify as, you follow your convictions, as you said, and stay true to yourself.
Thank you. Thank you so much. And I just want to move to, if anybody have questions or any reflections on what was being said, you're very welcome. Okay. So we'll move on. So I would like the next question to bring up about combining leading projects which are not always clinical with the actual clinical work. And so we will start with Nelia, because this is the closest person from the panelists to me, just to ask, what is the secret and what are tips and tricks for that?
I think the only tip or trick that I have is actually to follow your passion. Ukraine. So I think Inesa what is asking about how I combine my clinical work in surgery and then at the same time managing GMKA. I mean, GMKA is a huge passion. I wanted to help Ukraine even from the age of 18 years old when I immigrated to United States and wanted to give back. So it has been always my dream to be able to do that. And I have been working in Ukraine since 2012, as soon as I graduated from all my training. So that's why I'm combining it, but it's hard because it's like basically two full-time jobs. So you have to rely on a team. We have obviously you met all of them here in Ukraine. We have a fantastic team. You have to delegate, but at the same time you have to be passionate. If you're not passionate about that work, you'll not be able to combine it. And at the same time, you have to have continue doing the right thing for your patients. I did slow down clinically as well when I was making that decision. And at the same time, it's not just combining clinical work and NGO world, but also family as well. It's hard to raise kids in this, but I think we're all kind of in the same page. And it was very good to hear from Yuliana and Beata from last year. Those are the lectures that I heard last year, and I was able to, because you always feel guilty. Like no matter what you're doing, you're feeling guilty. You're feeling guilty because you're not in the hospital. Then you're feeling guilty you're not at home. You're feeling guilty you're not in Ukraine. Maybe I don't travel to Ukraine a lot. So last year talks at this conference did help me a lot because like, okay, I just have to, I do what I can. I do drop some balls. I try not to drop the important balls, but sometimes I do. And yeah, you just do the best you can. But I think the most important thing is actually being passionate about what you're doing, and then things happen.
Yeah, no, I would definitely agree with the passion. I gave up my husband. No, he's still there. No, just kidding. He's still there. He's still there. He's a nice guy. No, like to do work in Ukraine and to come on these missions, some choices did have to be made. So, you know, I have not gone to a nephrology conference like I used to. I used to travel frequently to give talks in nephrology. So that's been given up so I can join these missions we come here every 6 months. Sometimes we are coming actually every 4. So that's become part of my passion. I think when you're a young woman, particularly, not so much when you're old like us, because then you can just blame it on dementia or something, you forgot to do something, so it's easy. When you're a young woman, and I have a lot of young women under me, you really feel like you're failing at everything. Like you're failing at being a scientist, you're failing at being a doctor, you're failing at being a mother, you're failing at being a wife, and you're not. So what I tell my young women is to be much easier on themselves. But I also do tell them to prioritize their children and their family, because your children are only little once. And if I have one regret during my career in medicine, is I didn't spend enough time earlier on with my children. And I think we're in a world now where women can help each other. You can cover your friend. You can be there for each other so that you can spend more time with your children, because you're not going to get that back. Мої діти вже старі, вони вже вдома, то я маю багато часу тепер бути з вами. Але if I was going to do it different, трошки інакше, I wouldn't have spent quite as much time working as I did when they were young. And I'm just going to tell you about a really interesting thing. There was a really beautiful presentation of a full professor at the University of Toronto. And what she did is she was a researcher and she wrote papers. And she actually, and I found this really hit me, she actually did a timeline and how many papers she wrote every year per the age of her children. And when her children were little or there were issues in her family, the paper productivity went down. And then all of a sudden her kids got over and the paper productivity shot to the roof. So there's time. So it's still okay. All right. So just be easy on yourselves. Don't be hard on yourselves. You can't be everything. Now, I'm not a surgeon, so I don't know how they did it. I don't know how the heck you did it, Carolyn, because you also.
I think I had moments of success as a surgeon and a parent, and I had moments of failure. And I think it doesn't matter whether I was a surgeon or any other type of physician or any other type of professional. I agree entirely that the guilt is something that you have to just let it settle in, because we feel guilty. I don't know. I don't know how a male surgeon feels, or a male physician feels. If there's guilt, if they're also trying to parent, I suspect they do. I think that's human. I don't think that that's unique to women. I think we've got the market on it. I think we've really nailed it. We feel guilty very easily, maybe more so than men. But so I think, yes, you kind of just have to let that be there. It's going to happen. And sometimes you're going to be successful and sometimes you're not. I think the timing is, I agree entirely that when your children are young, you try to optimize your time. But your children also, children are resilient, and they learn from how we behave, how we model. And so, I would like to think that my daughter has taken something positive from the times that I wasn't with her. I believe so, and I don't think I'm just deluding myself. But I think that these are really difficult choices that we make, and you have to balance that drive and your ambition with your own well-being and the well-being of those that you love. I haven't figured that out perfectly. And if anybody has, please speak up and share with us what the key is to that. But it's at the same time, we're all here because we've had opportunities to be educated and to work in an amazing profession. And so I think we have to take that and do what we can with it. I was privileged to be born and raised and educated in Canada, away from war. And so I want to honor that. And so I balance that too with parenting. I want to balance my my opportunities that I have had, and then I want to share that with those around me. And hopefully that's something that we translate to our children as well.
I want to also say that I am a mother of 2 children and going through internal medicine, and I don't know how it is in Ukraine, but in Canada, it's a very grueling residency. Thankfully, a lot of change has been made to put restrictions on how long you're going to be on call. People realize that being for 30 hours on call is not doing your patients any good, not to say your own body. I do have some tragic stories to tell you of both of my children trying to drown my pager in the toilet because they knew that the soon the pager went off, mommy disappears. Nevertheless, yes, and the guilt will be there forever. I'm very proud of my kids, and I'm proud to say that they're very proud of me, and they go and tell everyone, oh, I have a famous mommy, she saves lives every day. Having said that, both are convinced that they should never go into medicine because mommy has been in school for 17 years and mommy is never there, and this is not what I want for myself. So hopefully it's going to get better.
Well, I'm going to end this with a joke because it's too sad. Okay, this part's too sad. So I said to my daughter, which she's now 25 years old, and she'll have her own children soon. I said, you know what'll be great is when you guys have your kids, I'll be home all the time and I can take care of them. And you know what she said? Mom, you're not qualified.
Can we just also say that how important it is to have friends and a good partner? I think it's very difficult to do it on your own. And I think it's really, really important to have a partner who will support you. And amongst many, many lucky things that I count every day, I'm incredibly thankful for my husband, who's not a physician and who's been there equally changing diapers and staying up and feeding and doing laundry. And he probably does more cooking than I do. And so I just a shout out. I know it's a shout out to good men over there. Thank you.
Thank you so much. anyone to comment on? Oh, yeah, sure.
I also already grown up, and my only regret is that I spent too short time with them. But from the other hand, if I spent, you know, that in Ukraine we can stay 2 years with a child, yes. Three. So in my way, I could stay 9 years with the children, but that way I would have a regret that I would rise as a doctor, I am also a dental surgeon. And so we will always feel the regret being a mother or being a surgeon or being a physician or being a mother. So we need a balance, as the doctor said, and just go ahead. Thank you very much.
I think this is a really, really good comment. I have to say that, so US is the worst. Canada has probably a little bit better policies. I think in the US, you get, 3 months? And then, 3 months. I had 6 with both of my kids. But I do have to say that at the end of the 6 months, I don't know if you have this in Ukraine, the baby and mom groups and talking about diapers and what you're going to make. I said, enough. I need to have some intelligent conversations. I need some critically ill patients. Otherwise, I'm going to lose it. So yes, you have to be kind to yourself. Do not let yourself feel guilty. You also deserve to feel accomplished and empowered to do the things that you want to do.
My name is Ulana, and I am a retired dentist, hospital-based dentist, and I'm married to a cardiothoracic surgeon. And I'm probably older than you are, so my story is just a little bit different because I was on the advent or the pioneer of women coming into dentistry. My class was the first class that had 18 women as dentists. Before that, there was only one woman in every class in Chicago when I was in dental school. And it was a very, very difficult time for those 18 women because all the professors were all men and they did not want the women there. And when I was taking my boards, I will never forget that day after, I was pretty good in operative dentistry. I was in the top of my class and we were taking the clinical boards and we were very prim and they taught us how to behave with our examiners, how we were supposed to be very respectful to them, how we were supposed to not, there was just a whole training beforehand. And the inspector that came to my patient, and he sat down to look at my preparation that I did, and he said to my patient, "How do you like having a woman working on you?" And the patient looked at him and said, "It's better than having your big fat hands in my mouth." And I thought I was going to go through the floor, and I just saw an F, that I failed my boards. But fortunately for me, and this is where also excellence is very important, because being a woman, you also have to be also very excellent in what you do. You can't be mediocre, So you have to strive for excellence and you have to strive for perfection. You're never going to be there, but you have to strive for it. And when I walked out of that clinic, that professor, which I was very courteous to, came up to me and he says to me, "Hun, who are you kidding? You're going to be barefoot and pregnant in the kitchen within the next year, and some guy who was supposed to go to dental school, you took his spot." And I just, we couldn't at that time sue anybody. You had no proof, but, you came home so discouraged thinking like, what have I chosen as a career? But, I was passionate about my career and I was already married at that time. So I had a wonderful partner. And again, all of these women have said this, that you have to have a partner that's going to support you. And then you have to support him because he was never home. And Ukrainian women have a very, very strong sense of guilt. I mean, I think all women do, but it's a joke amongst us that, our mothers just look at us and we feel guilty, so our children look at us and we feel guilty. So we're always struggling with ourselves. So these lectures today on the psychology of our brains and how we have to forgive ourselves and how we have to make ourselves happy are very, very important. So I think, having said that, I just wanted to share this story with you to let you know that, we are all here for you. Find, for those of you that are not married, find a person in your life that's going to understand what you're doing and forgive, and then you can support him as well. Thank you very much for this opportunity.
Thank you very much, and thank you for the story. You told your story, and it happened to me. And here I have my colleagues, women surgeons. I've been told that I cannot go into surgery in 2013. It's not that long time ago, and it happened still. And now I have a second-year resident. She's a woman, and she has also been told that she cannot do surgery because she's a woman. So thank you for the story, and this is very supportive and very reassuring. Maybe anybody.
So actually, I want to comment on that. You, I don't know when you experienced that in Canada, but in Ukraine we still have that. We still have that, and so so the whole movement, the whole Women in Medicine started from the experience where I was mentoring few young Ukrainian female surgeons to become a surgeon. So I have at this point 5 mentees. Inesa is one of them. I don't know if I'm a good mentor or not, but 2 of them. So I have Solomia Semenev, used to be a surgeon in Okhmaded Hospital. She left to Poland. Helena Shabat, who used to be a surgeon in Ivano-Frankivsk, she left to Italy, and she was the first Ukrainian in Italy who passed the boards and now is a surgeon in Italy. So and she was unable to become a surgeon here in Ukraine. Inesa is making it, but she's very persistent, and it's really, really hard. So that's kind of how we started. That's how it all started, and then everybody else, other specialties, wanted the same for them as well. So we can band together, we can do this work together, because in Ukraine this work is just at the beginning, and there's lots of jokes. There's lots of we talk about microaggressions in the United States and Canada. There's no microaggressions here. It's aggression. It's macroaggression. It's explicit bias. People to your face tell you. Actually, I have my own example. In 2014, I came here. I was giving a talk on robotic surgery. And they were coming to me because it was a surgical conference, all the males. They were coming to me and asking me, are you a practicing surgeon? And I don't understand the concept of not being a practicing surgeon. In Ukraine, we do have people who are in the clinics who are not practicing surgery, but they are called surgeons. So I didn't understand the concept. But then I realized, okay, so there are in Ukraine people who are surgeons, but don't practicing the surgeons. And they asked me this question, I don't know, probably 100 times. At the end of the conference, I was like, okay, look, I have 2 hands, 5 fingers on each, and I have a brain. I am a surgeon. I am a practicing surgeon. And things have changed a little bit, but not much. And we have to be together to be able to change the system. And there are multiple ways to do that. But we here, it's important part to be here and talking about this.
You also bring up in terms of changing the system, I just want to give you something, a little bit of a definition. Dr. Levis is going to talk to you about mentorship. But women don't need mentorship. They need allies. It's not enough to give you advice about, am I stealing your, no. It's not enough to give you advice about what you're going to do. You have to take young women and you have to give them the opportunities. You help them write the paper. You help them get into the course. You help them get the job. So that's the difference between being a mentor and somebody giving you advice. People can give you a lot of advice, but allyship is meaning they're going to actually take responsibility for moving your career forward. So that's another thing that the women in this room, because there's some of you are a little bit older, you have to think of these young women and not just tell them what to do, help them get to where they're going. It's a very big difference, actually.
Thank you, Michelle. Anybody to comment?
Just one more thing. One thing that I did with Inesa was her prior surgical mentor. I actually called up that mentor and was asking him, what did you let Inesa do today? And
but that's not effective, right? It might work for Inesa, it will not work for the hundreds other women surgeons who want to be a surgeon. So we really need to work on that and think how we can change it.
That was very effective for the one day after the call, but 2 days after the call, I was like, okay, now I called. Okay, and now I know my chance, my time. So thank you for that. Anybody to comment?
Shout out to Anastasiia Furtak. She's a surgeon here in Lviv at the UKU Clinic, and she has just been elected to the American College of Surgeons, probably the second person from Ukraine who's been elected to the American College of Surgeons. So it's a great, great accomplishment, and kudos to our women surgeons and physicians.
Thank you very much. Maybe some men want to comment here in the room. I see a few over there, far, far away, including my husband. Maybe he wants to comment something about partnership, being very supportive, or anything. Okay. During the lunch break, I think. Yeah. I just wanted to reflect on one of the comments that Michelle, you told me, and that's a great advice for me and for a few people in the room for sure. You told about having friends and having partners in the organization or at work who already have kids, and I am taking that advice. Two of my biggest partners in the organization, who is Katya and Nastya, they have their little kids, so I'm gonna get their advice and their help when I get mine. Thank you for that. You like all of you can be very good role models for me and for us in the room, for all these young female physicians. But can you tell about your role models and who inspired you through your career?
I can share something. So I had a strong female role model when I did a fellowship in the US. She happened to be a Canadian plastic surgeon who was and remains ahead of her time, though she's well into her 70s now. But she led by example. She was also very good, not only as a mentor, but as Michelle said, as an ally, or this concept that I'll talk about later, which is sponsorship, which is basically being a mentor on steroids. And that is somebody who gives you opportunities to go to meetings, be on papers, have leadership roles, take courses. But she really set the pathway for many, many plastic surgeons, hand surgeons, peripheral nerve surgeons. And she remains today a very active mentor for many people. But I also had a very strong male mentor in my training program, and there was one cardiac surgeon, female cardiac surgeon in the center where I trained, and no other female surgeons in any discipline. And I had a physician, a surgeon in my training program who was, he didn't exclude anybody. I mean, he was very inclusive way before. We're talking 30 years ago. And he also just led by example. He was a strong role model. He happened to be married to a physician, a non-surgeon, but I think he had what I would say is emotional intelligence way beyond that, way before people talked about emotional intelligence. And this is something that women leaders are often credited with, that you have emotional intelligence, and that's what allows you to be a successful leader. And so I would say that was something that he displayed. I didn't recognize it at the time. I only see it now in hindsight, that he was just someone who had a belief that people were essentially equal, unless we proved him otherwise, that we were less than equal. He started, and my other mentors, same thing. They started with the belief that all of the physicians, surgeons, we all started here. And then you had that potential to be there or even higher. Rather than the way we tend to see, and perhaps maybe more so here in Ukraine, that females, trainees, are starting here and need to ascend. I think a strong mentor views people as being at a high level, and that they can remain there and they can go up. So I had a very positive experience of two mentors, one from each gender. So I was very fortunate.
Thank you.
I can
Kateryna.
add that. So in Canada, transfusion medicine as a specialty probably didn't exist about 25 years ago. And I know in Ukraine it's completely non-existent. And they're like, what is this? It's a pathologist who sits in the lab and doesn't talk to anyone. And the person who changed it was another female, and her name is Jeannie Callum. And if you are in Canada, that name is a brand. It's like the biggest influencer you can ever have, because single-handedly, this person, this female, popularized transfusion medicine. And she did it by being a very strong leader, being outspoken, and really showing why this is important. So we're in the past and changing the dynamics, and then changing the dynamics for all of us. And now I look back, and coast to coast, we have very, very strong leaders in this specific specialty, and it's widely recognized. And I can tell you, if it's a difficult case, be it trauma or cardiovascular surgery, without hesitation, my colleagues would call me, the surgeons will call me and ask for my opinion about what to give in order to make this case successful. When they don't know what to do, they call me. That is massive, because in the past, blood bank was there to just give whatever you asked for without a question. Now, all of a sudden, not only we are suggesting what you should be giving and in what dose and when, we are also stopping you from giving inappropriate orders and harming patients. And that is a huge difference. So for me, Jeannie Callum was it. She also, like Michelle, happens to be short, but very outspoken, very loud, and never ever shied away from conflict. And I think this what inspired me to do something and be like her. And in fact, like, there's an entire generation of transfusion physicians who decided to go into this profession, who decided to do what she was doing because she was so incredibly inspirational. But going back to men, I also have to credit. So when I walked into St. Michael's Hospital directly out of my fellowship, I was told very openly by the search committee that I was too young and I was visibly pregnant. So of course I wouldn't be all there and wouldn't be as committed as the next male candidate would have been. And they're going to wait for somebody who was more senior and male. Nevertheless, in the end, I got a job, and one of my biggest advocates was the previous director of transfusion medicine, a male, who built essentially the lab from ground up, from a tiny bench, as some sort of a sideways business from pathology. And it was his baby. It was everything that he was proud of. And he said, I want to give it to you because I know you're going to take care of it, you're going to grow it, and you're going to make great things happen. And that was phenomenally empowering. He was quite accomplished, so he was able to put me on all kinds of committees, and he said, don't worry. So in Ukraine right now, the first step is to be invited to a committee as a woman, because, of course, why would a woman be invited to a committee that advises to the government or to the college or whatever? At the time when I was starting my career, I was in a position where committees were mandated to have female representation, which is a microaggression in itself, because the only reason you are there is to be the young woman. So you're not expected to say anything, but you make the committee have legitimacy and credibility. And he said, go in, be yourself. And yes, you're going to be a token young woman, but I have faith that with time, they will come to recognize that you are the force to be reckoned with. And that is incredibly empowering. So the first step is get yourself into the committee. The second step, don't allow yourself to be the token woman who is just making their numbers look good. Speak up and prove that you have just as much right to be on that committee as anyone else. And then you take the leadership.
Thank you. Thank you, Kateryna.
Maybe I can comment as well. So one common thing that I see actually among all of us, and even Roxolana's story, what you have shared with us. So what has helped us is to develop this area of expertise. So we are true experts in what we do. For example, for me, I am a appendiceal cancer expert, and it's very rare disease. Not that many people know how to treat it, other than Inesa's husband, Slava Kopetsky. And it's actually very empowering because as a young woman, so I am at Brigham and Women's Hospital Dana-Farber Cancer Center, and medical oncologists, they are obviously very knowledgeable in all the trials, chemotherapy, how to manage the disease. But appendiceal cancer is one of the diseases that actually managed mostly by surgery, and obviously chemotherapy has a role. But even among those medical oncologists, I was an expert, and even early on, they were listening what I had to say about appendiceal cancer. So very similar story to Kateryna's story. And then that's how kind of you get yourself in and you move up. But I think finding that area of true expertise, developing it, getting yourself on the committees, having somebody sponsoring you, distinguishing yourself a little bit from the other people or males and so forth. But that has definitely helped. And I see, like, I just now noticed that commonality.
And I can add to it. So I'm also an expert in a micro area of nephrology called kidney disease and pregnancy and preeclampsia, which I'll speak about this afternoon. And it's very, and actually I had a lot of mentors. Most of them were men, and they varied in their usefulness. All right. So, and I think that is why, as a matter of fact, because I do glomerulonephritis, and I was in a large group, and we didn't really have people that were mentoring in that group. And I'm going to give you an example of what happened to me at a conference. So I was very young. I went with my mentor to a glomerulonephritis conference in the States. I've been writing a paper with a nephrologist from Mayo Clinic. We must have exchanged 1,000 emails. And then when I finally said, "Oh, so nice to meet you in person," and I introduced myself, even though we wrote a paper together, he looked to my mentor, who was a great man in nephrology, and he said, "Oh, I didn't know they'd let them take their secretaries with them on vacation, like to a conference." So he thought I was the administrative assistant to my mentor. So that's when I said, glomerulonephritis, enough. And I made my way in pregnancy and kidney disease. It's also a very woman-dominated field. So it's a wonderful field. It's full of young women that you can then make their careers better. But I do see the point in finding that bit of a microcosm, because then you get in sort of with people that are going to be more supportive of your career. But I can tell you, I would have been a freaking excellent secretary. Okay? He wouldn't have missed anything. Nothing would have been missed.
The world would have missed out.
I'm telling you, I would have been a wonderful administrative assistant.
For sure, I approve, because Michelle was very supportive and helpful with organizing the whole conference. Whenever I emailed, she emailed back right away. So that was very helpful.
I was just going to say that I agree entirely that if you have an opportunity to be on a committee, even if you feel you're on that committee because you are somehow a minority, or you're filling the diversity quotient on that committee, who cares? Doesn't matter. You're on it. Do the work, make a mark, network, prove that you are there for a reason. And it doesn't matter what you're wearing, how long your hair is, what your color of your skin is. Just do the work, do your best. And if your opportunity to be on that committee is because you are somehow diverse in some way, great. it's your opportunity in, because you don't want to miss that chance, because of personally, I would say don't miss that chance because you're standing on some, high ground that you think you should be there entirely because you are
On merit.
better. Yes, thank you. On merit. It doesn't matter. If you're on it, do the work and you'll make your mark.
Thank you, Carolyn. Now we have like 8 minutes left, so each of you has 2 minutes. Yes, exactly 2 minutes. You can be shorter if you want. We'll have also we have a time for question if we have. I forgot about that.
I want to express gratitude for the conference and for your knowledge and skills and your support of Ukrainian physicians in their efforts to be better in their professional growth. And being a male and a husband and medical doctor and a partner of the best woman in the world. She's medical doctor too, medical director, and mother of 5 children.
Oh my God!
So we have something to add, and this is not a joke. This is very seriously, and I want to add like a team member. I want to point that family is absolute everything for us. Career is teamwork. I'm PhD, associate professor. I hope Viktoriia will be somewhere, but it is not role of victim. It's a role of brave persons. So being being here, I realized that I'm feminist too, and I want to express that teamwork is everything. I think everybody has something to add because we have short time, but I hope that you are grateful to the destiny and to the God that you have that position where you are. Your family, your husband, your career, and all the time that was the way of choice. That was a way of bravery. That was a way of overcoming of some obstacles. But this synergy in teamwork in family was that castle where you, I hope, felt yourself in safe position. And this synergy may make more incredible things. So I hope these examples will encourage our other people, not only women, but men, to be a part of this partnership, provide efforts to build new teams in our families, in our careers, in our jobs, in our countries, in the world. Thank you so much.
Inesa, I'll just say a few words as well. I just want to echo to what Dr. Kolesnik has said. So it's very important to have partners who are supporting you. And you met Sergey yesterday, and without him, obviously, we both wouldn't be here today. But I want to actually mention a few more people. And one of them is in the audience over there who has been sending me air kisses while I'm on stage. My godmother, my aunt, was able to visit from Ivano-Frankivsk, and she's also a career woman.
This is my aunt Natalka, who was a dentist. And they were my great support for myself, as well as my mother,
and kind of what has been inspiring me. Both of my grandmothers were my role models. One was in medicine, an internal medicine physician who wanted to become a surgeon and didn't because at that time it was very, very hard. And one is in the United States right now, but was also a career woman. So growing up in that household, it's easier, but it's still hard. But the reason why I'm saying it, because I just want to say thank you to Тетя Наталка. Тетя Наталка, дуже тобі дякую за все. She actually used to watch me when I was little. As my parents were in medical school. So yeah, she's the reason why I'm here.
So I think that at this point we will complete our session. I'm
this and been very supportive. And whoever wants to have questions or a little talk with the panelists, you're very welcome during lunch. Thank you.